You're my lifesaver, thank you. All right, so let me just show you in pictures what that would look like if we were doing a little video montage of that. So we've welcomed you to Flinders, acknowledged here that we are on Ghana lands. We're getting your essentials sorted. There's ways that you can get Wi-Fi and like Edurome, which is the university's internet network, if you would like that. So it's really, looking for Edurome and using your FAN, which stands for Flinders Authentication Number. So that's usually made up of whatever the first few letters of your surname in and then the other numbers. It's the same sort of FAN that gets attached to your email. And then you've got that information from there. I mentioned about sort of getting some general information from the university website about getting orientated to Flinders, getting a student ID card, transport, how you can get to and from campus here, getting the most out of orientation this week, finding your way and doing some of those sort of more centrally organised orientation activities if you're new to Flinders or you'd like a refresh because there's always new initiatives going on. There is help available, whether that's from us, but also around the university. Look for anyone in the yellow shirts today. They can certainly help you, and we'd like to think that we're a really friendly campus where you could actually just walk up to anyone and ask any questions if you need to know where you're going. Talked about Connect Week and those fun events coming up and some of these other physiotherapy events that we're coordinating to run for you. All right, so they've given us some top tips of different ways you connect with the university. So, of course, there's different social media things you can look at, different ways you can connect through student associations, and Ping is the university student newsletter as well that comes out. So, I don't know, has anyone who studied here at Flinders before, what is your email traffic like as a Flinders student? High, medium, low? Do you get lots through? Not too bad. Anyway, there's lots of ways you can connect. It will sort of all push to your university email. But certainly, if you're finding sort of managing that constant messaging a little bit challenging, I'm sure there'd be ways that you can work out, what's the information that you're interested in and relevant in when you're looking through that. All right, so officially, welcome. You are our cohort 13, and it is a lucky number because my birthday's on a 13th, and my life goes pretty good. So 13 is really good to be here. I've only got photos of a few of our cohorts there, but the top left was our very first cohort. I think we had about 18 students. At the time, I just finished my PhD and I started here as a casual lecturer teaching the first time ever the cardiorespiratory topic. Then I did happen to get a more ongoing job at UniSA, so I was there for 5-6-ish years, I think. And then 2018, I think I came back very happily here to Flinders and have supported and taught with our cohorts since. So we're thinking there's about 100 of you. I know there's not that many here in the room quite yet today, but that's the group to be able to get to know. Certainly that was the size of my cohort when I trained a number of years before that, but it's still a really great sized group of people to be able to get to know and to connect with. And the physiotherapy community, particularly in Adelaide, is still very a close-knit community. So it's really interesting now that I can look at people that went through my cohort and go, oh, so that person, I remember them. They're the manager now of Allied Health at RAP. Oh, this person's here. Oh, wow, they run their own business. And that person I connected with there. So it's a very connected and, like I said, hopefully a very welcoming community. And you're part of that already. And we're really excited to have you and welcome you to the profession. All right, so today's program was sent out. So you've got me talking at you for until about 10:15 this morning. We were hoping to welcome Matt Sutton here as well. So Matt is our academic lead, but he's rostered on supervising final year students on placement today in the Health to Go clinic that we run. So academic staff who work in the musculoskeletal area do teaching, but they also do clinical supervision in that clinic, and that just happened to fall on today. We do have Alex will come back and do a bit of a get to know you icebreaker so we can have a bit of a stretch and move and also help you connect with people before we head out to a morning tea break from 10:30 until 11. When we come back, Alex will talk a bit more about clinical placements and getting ready for that early. Kelly Huxley is our placement coordinator, but well done to me. I booked orientation day on the same day as the final years have got their neuro exams. So they're all down at the Repat hospital site doing Viva exam assessments today. So that's taken out a good portion of our staff, or our staff are in health to go, or they're here, or a lot of us are part-time and today's not a work day. So you will get to meet a select bunch of us today, but that's why we've got Alex is going to support us with that. Then we're going to welcome in Danielle Grant-Cross from the South Australian Sports Medicine Association. Mitch is coming after he's done his exam this morning to tell you about student life and the Flinders Physiotherapy Student Association. And then we have Casey Garnett from the Australian Physiotherapy Association coming. Then we'll have a nice long lunch break from 1 till 2, so we will push through the morning. This morning's session is being live streamed and recorded, so if there is anything from the session that you would like to go back or wanted to sort of check out again, that will be available through the orientation links on the university website. And I'm also still finalising a online page for the Master of Physiotherapy where I'll have all the slides up from today as well, so you'll be able to get a copy of all the presentations that we've got this morning. Then in the afternoon, this is where it gets complicated. We're going to kind of break into 3 groups and we're going to head upstairs to level 4 where we've got 3 different rooms and types of activities for the afternoon. So we're going to be really fancy in that when we leave for lunch break, we're going to give you a sticky note that's of a particular colour and let you know which room you need to go with. So about a third of you will come and meet back up in our prac room, which is W, stands for West. It's the Sturt West building. We are in South currently, so you would get to West by going to the end of this corridor, and there's a staircase that heads up. You could take those stairs all the way up to level 4, and then you'll better sort of dogleg wind around the corridor up there. Or there's the lift is down the bottom corner. It's where the mural is in the courtyard down there. If you take the lift up to level 4, that will also get you up there. The trick is that if you try and access the middle stairs from Sturt West, they only go to level 3. So you have to be at the end, one of the corners of the square, if you like, of Sturt campus. So we've got, north, south, north, south, east and west. So we're in a box here on this Sturt campus. You have to use one of the stairs at the corners to get yourself up to level 4. Otherwise, you'll wind up midway to level 3 and go, why is there no level 4? It was added on at some stage, but there's only access points at the end. Once you've worked it out, you will be fine. But if in doubt, find the lift. It will take you absolutely up to level 4, and then you can walk around from there. So what we'll be doing is I'll be doing an orientation to the prac room just to make sure everyone sort of knows where the spaces are, knows how to work safely in the spaces and things like that, so we fulfil our work health and safety obligations, to keep you safe and get you ready starting to practice with us. Have a Q&A with me in a smaller group if there's any other questions that you don't feel comfortable asking this morning or in other group settings. We'll have some of the staff there that you can meet and greet, and we will have a form for you to sign. I did leave some at the back and some people started to get them handed out. So just at some stage today, we will get you to sign that consent form. And there's 2 parts to it. One part is consent for practical activities. Obviously, if you're working and practicing practical skills on each other, it's about making sure that you're aware of your responsibilities around your own health and how you engage in the practical skills if you've got any health conditions and what you're looking at towards that, and when you're practicing skills on other people. So it's really kind of checking that there's an overall in principle of informed consent for each of you practicing with each other on prac skills. But of course you always seek that anyway, even in the practical room when you're working with anyone on a daily basis. And then the other part is around consent for really when we do assessments. We will use sometimes audio recording or video recording of assessments, and really that's as a backup kind of cross-check when you're doing a clinical skills, so we can make sure that we put in robust practices for our assessment and cross-mark where we need to the work that you've you've shown us in your prac skills or in your Viva assessments to make sure that we're appropriately assessing. So that information doesn't go anywhere else, but having that and also a photo roll for us is really helpful as staff to be able to get to know you. And so it's not for any other public sharing, but that information is on the form about what we're seeking and why. But any questions about that or feeling uncomfortable, please come and talk to me about that as well, and we'll have be able to work out sort of solutions if that's not something that you're comfortable with. But then, yeah, we can talk through that more if you like. So anyway, that's the admin part, but that's happening a little bit this afternoon. But amongst that, more fun is otherwise joining Alex in our other prac room, where she'll sort of give you more of an overview of her role and some get to know you activities, and also the different sort of supports we have for you with study. And then I've also got some students coming in who are the few people who are not on placement or doing neuro exams today, and they'll come and meet and greet you as final year students so you can hear from them what it's like, again in a smaller group where you hopefully feel more comfortable to ask questions, and also to do a bit of a tour around Sturt campus and take you around if you would like to have someone from the physio program guide you where to go, to show you key things like, oh, where is this health to go clinic, and where do they like to study, and what makes their life easier, and what have they found has worked well in the MPT. All right, you're not going to remember all of our names, except I'll introduce our academic staff now by photo. So as I said, Matt is our academic lead. He's in Health to Go today. That's me as course coordinator. That's Kelly, placement coordinator, and Alex was being my wing person this morning and helping me solve all my tech problems as our student engagement coordinator. In terms of what the different roles of each of us are, so Matt as academic lead really has sort of oversight of the whole discipline of physiotherapy, but particularly a focus on things where we need to engage outside of the university. So for us, that means liaising with our accreditation body, also working with different clinical partners and making sure that we tick all the boxes, dot all the I's, cross all the T's to make sure that we're meeting all the quality requirements of our registration body, but also what it means to, be a master's level course at a university. So a lot of that, as well as having real leadership in terms of the vision of our program and how we connect and make sure that we've got the best curriculum we possibly can. For me, as course coordinator, I guess Matt and I work really closely together. Our offices are next door to each other. You often hear us probably kind of yelling out to each other because we're too, because the walls are really thin, and we just go, "Oi, have you got that email? What do you know about it?" So we work really closely together on all these things. But for me, it's really around ensuring that our curriculum gets coordinated across all of our staff and all of our topics, that we're using good quality assessment practices, that we're always working towards consistency to improve the experience for you in terms of how you access information. I'm there also to answer any other broader questions you may have about the program. If you've got concerns or questions about study progress or different options and things, really, if you're not quite sure who to go to, feel free to come and ask me. But I do have some information on a later slide about perhaps who the best person is to direct different things to. If it's pretty well a query about anything placement-wise, do send that to Kelly. Hopefully that's sort of a fairly simple communication pathway. And Alex's role, she'll talk more about this afternoon, as student engagement coordinator. So she's really there as a person to help you navigate the university systems. She's there if things come up in life which are really tricky sometimes. She's not a counsellor, but we are there as an academic staff member who you can get to know, who can provide some of that academic counselling about your studies, or kind of go, I'm finding this is hard, I'm not quite sure where to go, like how could I, what options could there be? And she could be like, right, maybe go talk to, health counselling and disability services, or have you seen that there's this service, or there might be this grant? So we're there as really a navigator. She can help you sort of access things that are freely and accessible to you within everything that goes on at the university, which can sometimes feel really big or overwhelming, and sometimes you go, oh, I don't think that's for me, but having that encouragement and going, actually, yeah, I think that might help you in your situation or whatnot, and can confidentially listen around that as well. Of course, you're welcome to reach out to me about that, but that's kind of where what Alex's involvement is. It's things like some of the social events we're looking at. It's things like the mentoring program and helping you all connect together. So anything that helps you sort of feel more connected to us and connected to each other in the program is really what we've got Alex in our leadership team there to help with. For the rest of our team, now you've seen that there are 3 mats in our program, one with 1 T, the other ones have 2 Ts. I've put them on people's names and faces under the practice areas that they tend to best align with. But the reality is in physiotherapy is that we work across all these areas, and actually we're trying to break down silos of, oh, I'm a musculoskeletal physio and I don't do other stuff, and I'm a cardio physio, that's me, and I'm a neurophysio. We need to integrate across all these areas, but at the same time, these are the 3 kind of historical and the core practice areas, and still a really helpful way for us to teach and to kind of understand different scopes of practice that then you need to connect the dots with and start to cross together. So our MUSC team is the biggest team. That's also because we know that more than 50% of graduates will end up going into private practice. That doesn't mean that you have to go into private practice if you don't want to, but that's what the data would tell us is a common pathway for a lot of people. So it's a strong focus area of our degree. So we've got Matt Hocking, Matt Pryor, Tim Morris and Catherine Shepherd, in addition to Matt Sutton. So all the Matts are all MUSC people. In neurophysio, particularly in this area, we do have Tam and Belinda. Kelly, on the previous page as placement coordinator, is also in that neuro fold, in that neuro team. For cardiorespiratory, we have Tracy Radford and Adele Shaw and Julia Graham, who started with us 2 weeks ago, hence why we're still getting a photo of her. And I come from a cardiorespiratory background as well. So a tiny bit about me. I have not moved very far in Adelaide, I'm not going to lie. Just slightly up the hill is where I grew up, but did study at UniSA. That was the only physiotherapy degree in Adelaide at the time. When I graduated, I got one of the new graduate jobs at Flinders Medical Centre, so just the hospital next door. I worked there until end of last year. I was still working clinically there in different part-time capacities. Did all the ward rotations and things, but really found a passion for respiratory physio and educative care in the ICU in particular. So after a few years, I found myself in a clinical educator role. So I did some clinical educator work for the next students coming through. Stumbled myself into a PhD. I did that looking at muscle function, what happens to the diaphragm respiratory muscles versus peripheral muscles in patients in the ICU who needed mechanical ventilation and had sepsis. And then, so I started connecting to the Flinders program just as it was getting started, and had found myself out at UniSA and then back here again. So that's sort of been my joint clinical and academic journey, and how I fell into that area of practice that I love. We also have other team members that fit in as well. So we have Jill, Jared and Tori, who also teach in that musculoskeletal area, but Jill in particular has a really broad skill set. She is a most amazing generalist. She does paediatrics. She's just started a PhD looking at work with older adults. She does musculoskeletal. She'll step into our neuro exams. And so I know lots of people think, I've got to specialise in an area of physiotherapy. If you want someone who just is a really wonderful generalist, Jill is your person for just holding an incredible body of knowledge and connecting across things. So you'll see Jill in a whole range of topics, including as your topic coordinator for one of your first topics into professional practice. So you can see how she'd connect all of that really nicely. Jared, again, musculoskeletal and orthopaedics tends to be his own passion area, but he sits here with our university, but also is employed through the SA Health Rural Health Service. So he's our regional clinical educator. So he's had experience working in the country at Mount Gambier. So anything about working regionally across sort of country areas of South Australia, he's your person for that. And then Tori, again, sits with musculoskeletal, but Tori also runs her own private practice here in Adelaide, and she is continence and pelvic women's and men's health physiotherapist. She is going through her specialisation exams with the Australian Physiotherapy Association in this first semester. So if she's looking a bit frazzled, it's because she's teaching and she's going through, I suppose, that highest level of assessment that our profession has to be able to be acknowledged as a specialist in that area with the, through the APA's process. And I think that will make her probably the only one in the state of South Australia, or one or two. So she's really at the top of her field with that area. While it's not an area that we teach a huge amount in our curriculum, because it's not, I suppose, a bread and butter core part of new graduate work, but if that's the sort of pathway that you're interested in, then, Tori's your person to connect with that. Alex can tell her a bit about herself as well, but Alex really likes orthopaedic physio, and again, Alex has a brilliant skill set. She helps us out with cardio, she can do neuro, hospitals, you might see her in health to go, sort of things like that as well, but orthopaedics is really where Alex's passion and skill set lies. All right, so communication with us. I've alluded to a few parts of this already. So for when we want to get information out to you as staff, what we will use are our flow pages. So flow stands for Flinders Learning Online, but you will hear us perhaps sometimes call it what's called Canvas. Now, last year, the university has just changed from what we called Moodle to Canvas, and really that's just the software platform that the university uses for their online learning spaces. And so we're still making sure that we're calling it the correct thing. It's all flow, it's the same thing, but if you hear us talk about Canvas, that's just because we were going through a transition phase, which I'm sure anyone that studied here last year has had the fun of going through. Hasn't it been fun? Anyway, we're still working on getting our pages looking as neat and tidy as we can, but what we would do is really do announcements. So the important thing is for all your topics, you should be auto-subscribed to them and not permitted to unsubscribe. They should push to your email, but you can also check them on the online learning page. So that's things where we might be just an update for class this week. In case you haven't seen, remember to bring your towel to practical classes, or just letting you know I've posted the schedule for the exams on the page. Go have a look and let me know if you've got any questions by the end of the week, that kind of thing. So you'll get announcements through your topics through there. I'm also still setting up our new course page and working out how we can get everybody onto that page, and that will be for broader information. So the sorts of things we'll post out through there will be things like, hey, the APA is running an event, they've asked me to let you know if you're interested you can go along, or here's some job opportunities, this club's looking for a sports trainer, if you're interested here's the person to contact and follow up from there. So it'll be that type of thing that gets posted out. In terms of email, you will need to use your university email, and that's the primary way that we will communicate with you. And it was a good practice to get in the practice of checking that daily so that you can get those announcements, because sometimes they may relate to practicals you've got the next day, and that's the primary way that we will communicate with you. If you then want to communicate with us, the best way is if it's a general query about the topic, like you're not sure about some content or questions about assessment and things like that that you think other people would be interested to know, we would generally ask that you go through the topic pages and post them on the discussion forums that are set up within each of your individual topics. You can email academic staff, the topic coordinators as well. We'd prefer that you ask than not ask. So if you're not sure where to post something, we might sort of say, great, thanks, next time feel free to put that on the page. Please take that as it's just helping you find your way. We'd prefer that you ask than get nervous and not ask us through whatever means. So you can email your topic coordinators for that, but generally we would suggest that can be more for things that you don't feel comfortable sharing in a broader group, or maybe it's about some personal circumstances, about sort of either whether that's coming to class or other things that you're not sure about that you want to make somebody aware of, so we can treat that confidentially and work through that with you. You can also request a meeting time if you think that there's something that you want to spend a little bit more time talking through. And I'm pretty sure, I haven't checked with my staff, but I feel like we've got a pretty open door policy, and I know that I'm pretty comfortable that if come and knock on a door, and essentially if someone doesn't answer, it probably means that they might be sitting in an online meeting or something. But if you want to drop past and ask a quick question, I think we're all certainly very okay with saying, I'd like to check with this with you, would you have a minute now, or could we make another time? And then we'll tell you, actually, yes now, or actually, can you flick me in an email and we'll catch you in another time. So you can feel free to come up to us and chat with us as well. Feedback is really important. We give you lots of feedback. You'll probably get a bit of feedback out by the time we watch your practical skills in class and you get feedback on clinical placement. I'm sure at times it can feel very overwhelming, but we want to help you improve and we want you to help us improve and grow as well. So there's a range of things that we do in the Masters, again, to try and make sure that we are responsive and adaptive with our curriculum. So there are different things that come through that Flow online platform. There might be forums, feedback tools, sort of quizzes and things. At Flinders, at the end of every topic, there is a standardised, they call it a SET, Student Evaluation of Teaching, that the university will send out to you. I know it can feel really, really annoying to fill those out, but they're actually very useful. They are anonymous and they're taken very seriously by us at the university. They are used as probably one of the main metrics by which topics in our courses get reviewed when we have to present what we're doing, within the university and externally to show how we're going with our course. And when you rate individual teachers as well, that comes back to us and is feedback that we then take on into our topics and is part of our performance reviews as well. So they certainly do get, looked at. So being as constructive as you can in that is really actually genuinely helpful for us because that does get used. We will call for student representatives. I think Alex will run that process, and so from within yourselves, we'll ask for nominations for who would like to be a student rep, and I've got some information on that on a next slide. But essentially you would come and meet with me at least once a semester. You're that sort of conduit person that I can go to ask to sort of perhaps send some information out to the cohort, or kind of if I'm looking for people for open days to volunteer, I'll probably go to the student reps or then ask, hey, can you find somebody, like how's that going? So your job is to connect with each other, hear what's going on, and then we can have check-in points. We can have them more regularly if you would like to, but that's the kind of thing that we would do. We also do things like benchmark against other programs. We look at how we're going compared to other degrees across the country. When our graduates finish, we survey all of the employers to hear how they're finding how they're finding our graduates and our program. And then when you graduate, you'll also get a survey that says, looking back over your whole experience, how prepared were you for this? How did you find it? And then, of course, there's lots of informal ways. Again, you're welcome to sort of drop in so that we've got things that we can hear and respond to in a more timely manner. So we're not just waiting to the end of the degree to find you struggled with something. You can always let us know anytime you feel you've got something for us. And our clinical educators will give us feedback as well. Yep, so there is information about what the roles of the student reps will be. And as I said, Alan, I'll probably get Alex to put out a call for that. So think about putting a hand up if you'd like to. There's lots of different ways that you can start to sort of, connect within the program. There's opportunities through our student representatives. There's broader opportunities through like student associations, through the Physio Association. There's lots of different ways that you can sort of start to make connections within the physiotherapy community, both at university, but also out through, workplaces or other associations, SASMA, for example, and things as well. So choosing things that you feel you've got capacity for, interest in. I'm a big thing for going for passion. If you're not that interested in it, then, maybe it's not a good match for you. And doing that if you're interested and you feel like you've got capacity and would like to do so. All right, so on to more of the curriculum stuff now in terms of the course aims. I've got that up on the screen there. And look, there's lots of physio programs across Australia. I've lost count. I think there's 20, 25, there's a lot. We all have to actually meet the same standards and essentially have graduates who are safe and effective and have enough skills to step into the workforce to work across the broad range of areas. We know that people will have passion areas, but our job is actually to give you the foundations that you've got all the doors open to you, and that we cover core practice areas, cardio, I always say cardio first, cardio, musc, neuro settings, so hospital, rehabilitation and community, and across the lifespan, so from paediatrics right through to adults. But having said that, we've got our own values, we've got our own things that we think really make a great physiotherapist and have a career with longevity and flourishing, and these are the things that we value, and this is how we like to teach and what we think is important in our program at Flinders. So yes, connection and collaboration is a huge theme for us, helping people connect with their patients, with culture, across different environments. Regional and rural health is a real passion area for us. Having people that are professionally engaged and reflective, responsive, critical thinkers, effective communicators. That's what our hope is for you in the degree. So as I mentioned, our degree is accredited. All degrees in Australia need to be accredited for physiotherapy with the Australian Physiotherapy Council. So our next accreditation cycle is due 2026. So you'll all be finished by then. But if Matt and I look stressed over the next year and a bit, it's because it's a lot of work to prepare for those accreditation cycles. But as a student enrolled here at Flinders, what it means is that you will get a student registration with AHPRA. So AHPRA is the registration body. You can't call yourself a physiotherapist or practice as a physiotherapist in Australia unless you have your registration with AHPRA. What that means as a student is you don't need to do anything, but it means that the university will send the names of everybody that's enrolled. So AHPRA kind of has you on their books, if you like, as a student studying physiotherapy in Australia. So you don't get a number, you can't look yourself up on any registers or anything like that. But at the end of your degree, which means once you've passed all your topics for the degree, the university's confirmed it in the process that they go through end of every semester and year to confirm your grades. The university will then send and confirm with AHPRA, here's the list of people that have completed, so they will know that, you've finished your degree, and that's when you can then apply and get, and officially get your registration. So there'll be more information about that towards the latter part of next year. But essentially, what AHPRA will often do, because they'll, sort of know who's approaching registration, you'll probably get an email to say, here you go. You can start to get the documentation together that you need. There is a registration fee that we all have to pay every year. You can start the admin side of things. So really, once the uni says, yep, here's your name, it's all confirmed, you can get your registration. You can do it later if you want, if you're not in a rush, but you can do your part of the front end of the process, and then that ticks over from there. So I appreciate it can make sort of an anxious time, particularly December, when people are like, I've got an employer that wants me to start on the 1st of January, and I'm like, I don't know how long that's going to take. There's a few steps in the process, but, they're pretty quick with it. But also they're registering, tens of thousands of health professionals, every physio across Australia, every nurse that's coming out, every OT and so on. But it's a pretty good process. But what it does mean is that because you're connected to the profession, and for registration it does mean there are obligations that even come as a student and at the university around fitness to practice, which means in terms of your physical health and your mental health and capabilities that you're able to step into the role and to do the job that you need to be able to do. And that does bring other things that come with being a professional, is our responsibility in communities for things like mandatory reporting and things like that. So those professionalism expectations come as part of this process. All right, so I mentioned that we sort of have our own brand of physiotherapy at Flinders, and over the past years we've worked on this curriculum framework. So this is, as staff, what's really important to us, and we're working on making sure that we embed within our teaching. So if you are a student at Flinders and a graduate, the things that we want you to be, we really want you to partner. I said collaboration is hugely important to us, and developing leadership. And that doesn't necessarily mean having senior positions or being at the front of things. For us, leadership is who you are in different situations and acting and behaving in a way that influences others for good. So that may be leading in how you connect with each other when you're on placement, how you connect and communicate with other allied health assistants, or when you're a new graduate, is how you work with your patients. You can do that with integrity, and the way that you approach that, you can show leadership qualities in everyday interactions. And so, yes, it can be a role or a title, but it's actually an approach, and that's what we're really keen to support you to understand. What are your leadership strengths, and how does that work out in the individual therapist that you are going to be? The top left corner, exercise, manual therapy. We are a program that still values those really good hands-on skills, and hopefully I won't speak out of line for my musculoskeletal colleagues, but really that idea of a really good assessment, and a quality diagnosis for your MS case is really important to us, because if you can make a diagnosis, which I know means you feel like you're going to learn an awful lot of clinical tests for knees, hips, shoulders, back and everything, but if you've got good assessment skills and you can reason through to what you think a problem is, then the treatment plan, lots of that is skills that you can learn and adapt and work out what the approach is. And so that manual therapy, but those good diagnostic skills are really important to us. And even our employers will say, look, if they can do a great assessment and stuff, if a graduate needs a little bit of help about working out how to navigate that part, they're like, that's much easier to upskill in. So we really want to consolidate that for you. Behaviour change is important, because if you can't engage your patients to actually do what you want them to do, then you can have great assessment skills, but you need to be able to partner with your patient. And behaviour change is a particular passion area of TAMS, and looking at adherence and how people do adhere to their exercise program or other lifestyle things so they can actually get meaningful long-term health changes. So that comes into other themes of prevention, rehabilitation and maintenance. So that's how we achieve all of those things. We've got different personal qualities in the bottom right-hand corner. Being an educator, that you help each other, you educate your patients. On the bottom left, we've got interprofessional. That's another huge focus for us here at Flinders, evidence-based and culturally aware as well. So the interprofessional practice is really important for us for several reasons. One, it's a priority of the registration board. They have, in the past few years, put out different consultation papers about how professions need to work better together. It's come out in the new physiotherapy accreditation practice thresholds. There have been 3 areas that have been strengthened that courses need to demonstrate. One of them is interprofessional, and that is such an easy box for us to tick because we've been doing that for a long time here at Flinders. But it's also one of those things that perhaps people make complaints to, the public will make complaints to registration bodies about, is where things haven't connected well. And I'm sure you've had an experience where you've gone to see a GP and they've referred you to someone else, and it's just downright hard to get health information, isn't it? And to sort that out. And what we actually need is health professionals that know what each other does, they understand their scope of practice, they're willing to learn enough knowledge about other things that they can support patients in that too, because it's a precious time when you've got your patient with you. You may only see them a handful of times and they're going to go out from there. So you've got an incredibly privileged time and role to be able to help them holistically with their health, and that means working together with other people. So we do invest in that because it's good for the public when we have health professionals that can work in that way. And also it's fun because you get to work with other people as well, which is actually the best part of our jobs, really, isn't it, when you can connect with other professions. So in terms of the Masters, look, it may feel like a real step up. It depends on, perhaps what your study experience has been like already, or how you work, or if you're new to coming back to study for a while. It's true, it's going to be a different rhythm change and a different pattern and different habits that you're going to work through. I guess we think it's a step up because at Masters level learning, we do have to push you to not just to know stuff or to demonstrate stuff. You need to be able to critically reflect, bring information together and in a more complex way. So that's what we need to support you to do. It's a step up because also there is a much greater reliance on independence and self-direction in learning. So it's not that we are going to give you all the content. As you can tell, we like to talk, and it's hard for us sometimes not to, but the best way we can help you is to partner with you and help you work how to discover it and to get the knowledge and the understanding in a way that makes sense to you. So I'd like to see us here as, yes, we've got knowledge and skills, but you've got knowledge and skills as well. We're really here to partner with you, kind of be like coaches. Yes, we're going to help you find your way, understand what the different scopes of practice are, but a lot of it is going to be on you understanding where you're at with your knowledge and skills and learning, and to help partner with us to let us know where you're finding things hard so we can help you navigate. So that independence and self-direction is likely going to feel different in terms of an approach for you. Peer and social learning is really important. I've talked a lot about, collaboration already, and the connections that you have with each other. But we also know from evidence that the people who can connect with their peers and will sort of support each other and study around that will, there's a greater likelihood of getting better academic outcomes. But it's not just about academic outcomes, it's really academic outcomes so that you can be better care for your patients. So we really will encourage you, as, I'm actually, even though I'm here talking, quite an introvert, like for me to cross the room and talk to someone still fills me with fear. And that might be how you feel too, but I want to encourage you to be brave and be bold. I know that you'll find people that you connect with in this cohort and work well with, and that's really great, because sometimes you just want to get stuff done with the people that you can be really, efficient with, and that you feel safe and comfortable with. But at the same time, to learn from each other and hear the variety of different ways that people think about things and connect and to support each other will be really important. And I really encourage you across this first year in particular to try and make as many connections with each other as you can, because we don't see you much next year. When I show the timetable, there's a lot of placement activity, and we know that you will thrive and best and feel most comfortable when you go on placement and you're with someone in your cohort you haven't met before, and all of a sudden your clinical educators paired you up and you're going to see a patient and having to work out how you're going to work together. So the more you can sort of build and sort of have those open conversations and that welcomingness of each other over this year, will really help with that. It also means when you're in prac exams, and we randomly pair you up with people, you've got some of those connections there as well. So we think it's important. We can set up the environment for you, but that's where we would really love to see. That's where you come in, and we want you to connect with each other to make that happen on your side of things. We do ask you to appraise your own work. So it's that whole thing of, how did I go? What went well? What didn't go so well? And giving us a really honest appraisal. Sometimes you can be really hard on yourselves. Like, celebrate the stuff that you're doing well and that you actually do know. It's not all bad. There's lots of things you can do and you will be able to do and you already know. But at the same time, we don't want you sort of overshooting and kind of missing areas as another. So there's a bit of calibration that happens about understanding, where am I at? What do I need to work on? What's going on here? We are looking for professional and adaptive communication, and so we do want to see that, right from the start. So that may be a good chance to practice in how you email us as staff and how we want to communicate with you. I could say treat it like a job, but I'm pretty aware that there's probably some pretty different workplaces in there, and you may be buddy-buddy with your employers. But think about if you were going into a job as a physio, how would you present? And if you can write your emails in that way as a start, that's a good foundation for how you want to sort of connect and think, these are my colleagues, you are already my colleagues and my peers. We are going to be, working together as colleagues for much longer than I am your teacher, if you like. I'm here for 2 years, but beyond that, we'll work together. I'm sure some of you might come and want an academic job at the uni one day. I don't know, I've worked with my lecturers and stuff. You're a member of our profession. So we do want to have that professional communication and trying to adapt it to those different contexts and styles. It is hard in the Masters sometimes to manage different topics. You will have some topics which have a more clinical focus, which I know are kind of easier to focus on because it's the hands-on doing stuff. But there is that clinical teaching, and there are other, I suppose, what we may call non-clinical, as in not hands-on, but they're still essential skills for practice. And so there is a bit of a challenge for workload management in how you're going to manage the different topics for you to work through. But again, that's not that different to if you were working in a job as a physio where, you know, you do have admin to do, you do have patients to see, gym classes to run, like you do have to multitask and juggle a lot of things in the job. And similarly, that's kind of, reflective of the program as well. It is a full-time study load. I've had, Mitch was telling me that sometimes they would have liked more time on class. He felt like orientation, I was already scared that it was going to be really intense. And then I realised, I still wasn't in that much. No, I thought I'd be in class more during the time. So I guess it may feel different for you. It may feel like it's a lot, or it may feel like you're expecting more. So just be open to explore what that feels like in terms of the study load, except that just to sort of provide some context. So at Flinders, when you take a 4.5 unit topic, that generally equates to around about 135 hours of work. So you've got 4 topics this semester in a full-time load. So that 135 hours isn't you must spend that time. You know, that's the kind of general thinking around how much content roughly goes in a topic. Some people may just need to spend a bit more than that, and some people may need to spend less. But what that includes, it's your lecture time, it includes the preparation time for each class, it includes the time that you're here in practical class, it includes the time that you're revising and preparing for assessments and that independent practice. So it's the whole package, and that's where that independent practice to try and put in that time to be as successful as you can. But we do recognise that cost of living is just awful, that lots of you are working, and actually this is one part of your life and who you are, and actually those other parts of your life are really important to who you are and the therapist that you want to be and the jobs and the lifestyles that you're looking to have. So we do acknowledge that, and that you have great numbers of skills from previous degrees and everything that you're bringing to this program, and it's a real asset, and we're really glad to have that broad skill set. So I know that people will be working in things like that, but I guess I just want to flag that it can be a real pressure point for people as to how they juggle that load and those different things as well. So I haven't got solutions for you, but at least if I can try and be upfront around this is what the curriculum looks like, it hopefully allows you to prospectively plan and work out how that's going to look for you. So holding down a full-time job and full-time study is probably not what I'll be recommending, in fact almost certainly not, but again it's with your well-being in mind, because I don't want you to be unsuccessful or challenged, you know, in either spheres of your life. But acknowledge it will be a juggle, but I'd encourage you to kind of, of course I'm going to say, put your effort into your studies, you know, try and get there, because at the end we want you to be great therapists so that you can work as a physio, and that, you know, really changes things for you there as well. So it is a focus on critical reflection. We do want you to fail or fall forward. We know that we have a lot of high achievers in this course, and sometimes this will be the time where it's the first time something doesn't go to plan for you, or, you know, a placement or an assignment or something, you know, does fail. We have very much a growth mindset. It's not that it's often that not yet. And so you haven't been able to sort of demonstrate this at this time in this capacity, and we're here to support you in what that journey looks like. Or if you don't know something, we appreciate the honesty, and your clinical educators will as well. If it's I don't know, but we want to see that second part of the sentence of I don't know, but this is how I think I could find out, or could you suggest something to help me through that? So you've very much got that sense of where you're at, but you're also being proactive and independent and kind of going, but I know I need to sort this out somehow, and how am I going to do that? So we use a lot of problem and case-based learning. You know, a lot of people have got different goals, but it is a journey, and we would like you to enjoy this journey as much as you can. And that means studying a breadth of practice areas. As I mentioned, I know that you'll each have different passion areas or you may not, and that's completely fine as well. Like having that generalist skill set is just amazing, but you will need to cover all the areas in your degree, and it will make you a better therapist at the end from having had that experience, whichever path you go into. Because it's important that you know, even if you end up in hospital work, that I understand a little bit about what it's like to work in MUSC or in private practice, because they're still my colleagues as professionals, and when there's pressure points for them, I want to be able to empathise with my colleagues and be like, oh, yeah, that must be really tough for you. Or when stuff changes in aged care, I want my colleagues in private practice to be like, wow, my colleagues in aged care are having a tough time now, or wow, the Royal Commission's really changed how they work in that sector. So we're all in this together, so having that breadth is really important, and integrating content across topics. All right, but we do have a lot of good and fun things, so let me showcase this to you now. We do have our on-site student clinic in Health to Go. That does have a lot of our musculoskeletal placements, but I believe there's some building work just around the corner on campus for some paediatric clinics. So we're looking to grow Health to Go if we can get space anywhere and the different services we have. I've talked about how interprofessional practice, which we abbreviate to IPP often, you've got a dedicated topic in this first semester, but then we thread it all the way through for all those reasons why I said it's important to us before. We're really passionate about rural and remote health, and that's in South Australia, but Flinders University also has a geographical footprint and campuses up through the Northern Territory, so that's part of our university as well. And this year, we're also starting a new degree. If you hadn't heard, we're running a Bachelor of Physiotherapy in country areas. So we have got our first students in Port Pirie, Renmark and Mount Gambier. So I don't know what opportunities for connection there will be there, but Matt and I will be looking for that and trying to build that together. Alex will talk to you about peer mentoring. That connection is important to us. We have great connections with different professional associations. You'll hear from SASMA and APA a bit later on. Our clinical specialist teaching staff, so many of our staff are still involved. They're part-time because when they're not here, they're working in clinical practice and have those connections. And then we also have some great research capabilities and leadership as well. So I'm what we call like a balanced staff member. So when I'm not course coordinating, I've got my own research program that I run. So does Tam Levy, Belinda Lang, and also another colleague of ours, Lucy, as well. And all staff are involved in different elements of like research, whether that's research on good education or on clinical practice. So we've got a really diverse and wonderful team that we have together. So some photos, we've got some fun photos. This was from World Physio Day last year about how we use simulation. So we do different levels of sim. We do some which is quite high tech in the simulation labs, but we try and sort of do all sorts of levels of it. So this is just up in our prac rooms. So you can see Alex and Jill there. That's Kelly in the middle. She hates that photo with glasses on in the bed. But it was on Facebook, so I can show you if it was on the uni pages. And this is some of our final year students learning in some sim activities with role play patients last year. We also do try to incorporate sort of tech and different innovations in teaching as well. We have a huge range of placement partners and industries. So the bottom left photo is out at Brain Injury SA, where again we've set up an interprofessional clinic. We work fabulously here with our other colleagues. So we have physio students that will go out with speech and OT students and work together on placements. And this is an example of one of those, where they're doing a student-led clinic where they actually lead with pretty well all the clinic activities there. It's pretty scary for them because they often want to be able to check in with their supervisors, and maybe they'll have a speech pathologist supervising them and not the physio on that day, so it really pushes their clinical skills, but gosh, it's fantastic. The patients that wouldn't otherwise be able to access care are able to come into the clinic, so it just serves a whole range of good. And then we have some other photos of our students that were able to head up to Nhulunbuy, which is in northeast Arnhem Land. East of Darwin there, and certainly, the style and sort of nature of that placement and the different sort of cultural experiences that they've been able to have there, and it's really two-way learning. So they're learning a lot about culture and building those relationships so they can work with the people that live up there. So in terms of what you will study, and getting your enrolments sorted, you should have the study plan of the different topics and who's involved in each of them. You will see us abbreviate the topics, and so if you find an abbreviation that doesn't make sense, please let us know, because we probably aren't even aware that we're doing it sometimes. But if we say, oh, what's my PMF? Your PMF is your performance of movement and function. If we start saying MSK, we mean musculoskeletal. If we say cardio, it means cardiorespiratory. I didn't put it in the bottom one, but physiotherapy clinical practice, we call that PCP. Have you noticed Australians shorten everything? We had the posties, you do this. We can't help it, we do it to our topics too. So generally, if there is actually anything that we're abbreviating or using our own physio-discipline Aussie slang for, please let us know, because we're probably doing it without realising. But we do want you to understand what you do. In the second part of the year, we have some other topics there. Neurophysio comes in there, complex case research topic, and the rest are different placements from there. So hopefully you've been able to enrol and register in your topics. We do have some staff who've been working on trying to get to a bit of a fact sheet for you, because we have found that people have struggled to enrol in the past, and often we can't see what you're seeing on the system. If you've got questions, you can go through Ask Flinders and they can help you enrol. But just to let you know, for the Masters, if you see a class that you think you're meant to be in that you can't enrol in, it's most likely one of two things. It's either just because we're still tweaking, working out who's starting with us this year, we may have some of the room capacities not set, quite right to balance the class sizes. So it may be as simple as, I check that and we can get you enrolled. But the other thing is, in your second semester, there'll be a bunch of cardio classes that you can't enrol in, and probably in that PCP clinical placement topic that you can't enrol in. And that's okay, because what we need to do is work out where you're going for placement at the end of the year and which time slot you're going to do it in. So once we work out that, we will get you enrolled in those classes, and then that will open up the opposite classes you need to enrol in. So if you can't do those ones, don't worry about that. As long as you're enrolled in the parts of the topic that you can, we'll sort out that back end of the year closer to the time. So I know you can't see that calendar, but from the orientation information in the course book, it's hopefully quite clear that we don't do anything quite normally in this degree. We really have non-conventional semester dates that we certainly don't align with the bachelor topics. So in my first column here, I've got what your study program is. With green is time that you're here on campus. Yellow is when we have placements scheduled. For the final years, they get two columns because they jump in and out between placement and topics and work here at uni. The next column, the grey, is the normal university timetable, so you can see where, if you were doing a bachelor degree here, where you might overlap with break weeks or not. And then the final column is the placement dates. So in Australia, we work on a national calendar for placement dates. So here in South Australia and actually the eastern states, I think Perth and WA might do their own thing. But essentially it means that whatever your university at, we all work in these 5-week blocks with our various clinical partners. So you can see how we kind of align our curriculum with what the national placement calendar is for physiotherapy placement. So that's why everything's kind of chunked up in these 5-weekish sort of blocks, and the approach it has and how things align across there. But what it does mean is check your timetable for where you are. Things do change from week to week. As I said, sometimes we'll put out those topic announcements if we think there's a fairly significant change, just to remind you where we may be in a bit of a different location. But any questions, and please ask us. Oh, I'm really running out of time. So I mentioned before that Flow, Flinders Learning Online, is the main place where you go for your learning. Depending on where you've studied before, you may be more familiar with face-to-face lectures and things like that. But really, those online sites is the go-to place where all the information is kind of held and goes from there. As I said, sometimes you'll hear us calling it Canvas. You should be able to access all of your topics from there. So we really encourage you to get familiar with those topic sites. So because they only go live 7 days before classes, that's why you won't have your MSK, your musculoskeletal 1 yet, because that starts a little bit later in this semester. So you'll get that in due course, but you should have your PMF and your IPP already accessed. So our teaching program, how we approach lectures here is lectures are fairly well, almost always, I can't think of an occasion where they're not anymore, pre-recorded and online. Okay, so this is why we don't use this lecture theatre space anymore, because we don't really need to. So you will need to watch the lecture content, usually before you come to practical class each week, and those lectures will be on that online learning page. The practicals are essential to attend because that's the time where you get to learn the skills, where you can get feedback from us on your skills and to work with each other. We do video recordings, and we try and set up recordings of as many of our prac skills, again, that you can watch before class and access, but it's quite different to being in the room and watching it being demonstrated live and practising it live. So we will often have the lectures, maybe some quizzes or some other readings and things to do. So there is substantial amounts of preparation work, which is the knowledge you need to then come in and do the prac skills and the pracs each week. If you have a tutorial or a workshop, again, the idea is if it's something that's scheduled live, it's because we want to achieve something in a live session. It's because we think that group discussion is important, because we want you to teach each other, share ideas, or we want to have a conversation with you about the content. So it may be face-to-face. Sometimes we will run them online, but again, we still want that interaction online, or sometimes it might be hybrid, which means we've got different ways of joining in. So you check your topic pages, but really, like, if you're paying for these topics, to be honest, it's that face-to-face content where you get to spend that time. Like, that's the interaction I want for my learning. So I would, my practicals and my workshops and tutorials is what needs to happen. And then we've talked about, that independent study, and then the recap at the end of the week where you start to put it all together. We'll see the practical rooms this afternoon. Most of them are here on campus, and you'll see our offices are all up around the prac room with the OTs as well. I've talked about some of those other spaces, but the university does also have places out at Flinders Medical Centre, FMC, that's the hospital out there. There are teaching spaces up the hill on main campus that we use from time to time, particularly if we're doing sessions like this where we need everyone together. There aren't that many spaces across the university, so we do find that we travel a bit. There is space down at Door Park, so there's another hospital site. You'll hear people talk about what they call the repat. That's sort of about 5-10 minutes down the road towards the city. That's actually where physiotherapy used to be. So when this degree started 14 years ago, that was our building, and that's where we taught there, and we've moved to Sturt, and now sometimes we move back there, like the final years for neuro exams today. That's where they're doing their exams, is down at that site there, and things from that. So we'll get you to bring your own clean towel to when you do prac classes, and we'll orientate you to the rooms this afternoon. All right, I've really run out of time, haven't I? We'll blame the tech issues to get us started from this morning. But assessment, really, if you've got questions, ask your topic coordinator. And again, I'm really happy to answer any questions you might have. The key information you need if you're working out what am I being assessed on for any given topic is you need to look at a document called the Statement of Assessment Methods, or the SAMs. That will be on that flow page for each of your topics. It tells you how many assessments there are and what they're weighted at, and those sorts of things. You will get more information about assessments in the topic book. Again, every topic will have a topic book on that page. And again, there'll often be an assessment portal where there may be templates or further explanations as well. So you get all of that online. We run our assessments consistent with the university's assessment policy and practices. So that guides how we make decisions about situations, whether that's, are you allowed to resubmit a task or not? What are the guidance around extension requests? Or if you need a deferred assessment, like how are you going to do that? We're going to make our decisions and give you advice that's in line with that policy and practices across the university. And it tells you things like, when supporting documentation is required. But that's a lot of information, and really I think the take-home message is that if it's any live assessment, so that's like prac exams, like an online quiz or test, if you're away from placement, all those sorts of things, generally we will need some supporting documentation for why you've not been able to sit that exam on that day. Sometimes you get gastro on an exam day. It just really sucks. But, we need those processes in place for that. And then there are some specific conditions to clinical placement as well. And that also relates to the work integrated learning, or WIL policy. And really, I guess that's just a flag that because of the national placement calendar and things, we can't sort of have extensions on placement. They need to happen in the timetable blocks when our partners have said that we're available to supervise. And there are no supplementary assessments for placement. So I know that's tricky, but if you are unfortunate enough where you are not successful and you don't pass a placement, it does mean re-enrolling in the topic again, for having another attempt at that. But again, any other questions around that? Well, there'll be more information in placements, but if you've got questions particularly around that, I can answer them, and certainly Kelly as well. The types of assessment we have are really varied in the Master of Physiotherapy. We know that assessments basically drive what you're going to learn, so we try and make them as good for learning as we can. There are always opportunities to practice in class. That's why coming to class and doing your practical skills is so important, because it's the time that you're putting into what we're then going to ask you to show us. We often do have some live or technology-enabled assessments. So some of our assessments will require you to record yourself doing a skill and upload it and things like that. We do have written work in the program, so sometimes you'll be doing individual or group work, which is like an essay type thing, or you might be putting together a portfolio or writing up a case study or things like that. So we do have some of that more conventional written work. We also have like the online like quizzes and tests, but we have a real strong focus on demonstrations. So prac exams or OSCEs where you come in, pick up a card off the table and you'll show us the skill that we've asked you to demonstrate. We'll ask you some questions about it. The oral exams or the vivas, we give you a case study that you've had a chance to view and do some pre-preparation for. You'll sit down and I'll have a conversation with you and say, all right, tell me about your patient. Give me a handover. Well, my patient today is Mr. So-and-so, is a 55-year-old with, this condition. So that's designed to simulate the types of conversations and the reasoning that you'll have with your clinical educators on placements. So that can feel very different, and certainly being assessed on placement. So there's a lot of people watching your work, which I know can feel really scary, but we have chances to practice and we do build that up throughout the program. So some different ways of being assessed. If you do need information about different policies and things, again, that guide how we make decisions so that it's transparent, so you know that we're making decisions in fair and clear ways, is we either look at course rules, and there's information on like what the university calls handbooks, so you can look up the topic learning outcomes and those sorts of things there. There are different course information pages, there are placement pages. The university has their policy library, and the sorts of key things you want to look at perhaps are things like assessment policies, academic integrity, so what that means here to make sure that, where the use of AI, artificial intelligence in assignments is allowed or not. We try and put very clear instructions in around what's acceptable or not for different pieces, what that means and what academic integrity means for us, placement policies and student conduct. Which leads me to the reminder that, it's important that everyone feels safe on campus, and we take it very seriously, and so does the university as well. So certainly if you witness anything, it's okay, and we would encourage you to speak up. There's ways that you can do that anonymously in terms of, reporting or making complaints or making people aware online, and we commit to sort of to listening sensitively and supporting you as well if we see anything to help make sure that our campus is a safe place for everybody and how you can navigate through that. Again, the policy library gives more information about, situations if you do have an appeal or complaint, that we will listen to it fairly and we'll go through due process with that. If someone does struggle with their study plan and needing to perhaps repeat topics, that's the sort of thing where you perhaps want to chat to me about things, but there's resources around student success and progress. I know sometimes there can be a fear of, oh no, I failed a topic, that means I'm going to be kicked out of the degree. No, you're not. There's a whole process that goes through around supporting success, because at the end of the day, we want you to succeed. Yes, your journey may take a bit of a different time path or way to get there, but there's conversations and the support's available, and that outlines how we approach that. Again, if you've got any other changes to study plans, I'm the person to talk to, and we've got some other things there as well. I still had to leave the COVID safety on the end, because even though we don't have specific restrictions, we still would like everyone to be well if they come to class and don't, it might be COVID or something else, but being healthy in class is much appreciated by all of us, because we've had experiences, I'm looking at Tracy and Alex up the back, where I just know that the mid-year ball was fun, isn't it? Everyone tends to get sick after that and go to placement on Monday afterwards. Everyone got COVID after the ball the other year. Anyway, prizes and awards. Look, the university we do have some prizes in physiotherapy for the end of your degree that get awarded. If that's, if that's just something to spur you on. There's a whole range of different services available on campus. We will often refer you to health counselling and disability services, really because there is free counselling available. They're really great services and really helpful up there as well. As I say, we're not counsellors, but we commit to sort of listening empathetically to you and helping you find your way, but where you need that expertise and help, the university is fantastic for those supports, and Alex will tell you more about that later. There's different sort of like wellbeing centres like Oasis at the uni, and international student support as well. So for those of you that have come from overseas and are juggling a whole range of new life adjustments, let us know how it's going. I guess ISS are here as well, but within our program we've got Alex and Tracy up there, but also Catherine Shepherd as well is really passionate about helping you get to know our program and connect. So if you're looking for people, we're all happy to chat to you, but Alex, Tracy and Catherine have taken a particular interest in trying to make sure that we provide connection points with you and support you in your studies. There's scholarships and grants. The career site is great to get onto as well, because there's part-time jobs and other things that come up. And I think I have gone well over time, Alex. Can we still do a 5-minute icebreaker?
Everyone stand up.
Everyone stand up. Oh, we must get you to morning tea in 5 minutes and then back here at 11. But do you want this?
What we're going to do, the photo that's on your phone home screen, I want you to turn to the person in front or behind you. So it's hopefully someone that you don't know. Thank you. And I want you to share and explain what that photo is on your home screen. So it's just a little bit of a get to know you just before we go for coffee. If your photo is maybe not what you want to share, change it quickly. But yeah, all right. And we'll walk around and get involved as well. Yeah. Try for someone that you don't know.
Okie dokie. All right, fantastic that you've chatted. Because hopefully it means you've met somebody to now go have a little walk with when we have a morning tea break. But I do want to introduce, we've got different staff, as I said, in and out today. We'll have morning tea, so I'll let, you can tell us about yourselves, or can I? We have Jill, who was, you know how I said our generalist extraordinaire who knows everything about everything? This is Jill in person. And we have Tracy, our cardio queen. So do you want to say, I know you'll talk with Alex later, but you want to say hi or anything to everyone?
Hi everyone. Usually I recognise lots of faces. Yeah, Jill of all trades, master of nothing but everything. Yeah, thanks Claire. I would have met some of you in a topic in third year if you were doing undergrad here. So it is always something I like to say, and that is in undergrad days, it's funny seeing faces and knowing that in a heartbeat you'll be colleagues, and it's goosebumps. It is the air conditioning, but you're really close now. So yeah, this time will fly, and I could tell you about the topics that I'm involved in, but yeah, I'll see you all anyway. Yeah, good. Sorry, IPP. Yes, that's on my watch this year, isn't it, Tracy? Yes. Inheriting this topic from Tracy, who is the guru of IPP. So, yeah, there you are.
So I'm Tracy Radford, and I topic coordinate the cardiorespiratory topic, and will try and convince at least some of you to become hospital physios, even though I know that you all want to do sports. And I've got a track record. I suppose just from my perspective, as the oldest member of staff, so I'm the old girl, is that I just want to reinforce to you that if you have, what Claire was saying before about if you have any concerns about anything, or things happen in your life that mean that it's impacting your learning, come and talk to us, all right? It's really important that we know so we can help you. Otherwise, we just think you're not turning up, or you look stressed and we don't know why, and all that kind of stuff. You don't have to tell us the whole gory story if you don't feel comfortable with that. But if you need help with your learning, please don't hesitate. Alex is our SEC, our Student Engagement Coordinator, and she is often a first port of call, and she'll talk about that this afternoon anyway. But if you're not sure about something, go and talk to Alex. You can talk to any of us, really, but Alex is your main woman person to contact if you're not sure about something. But yeah, and welcome to everybody, and come and get to know us.
Thank you. We'll hear from Alex a bit later on. It's important that you get a good break, and I know I've run you a few minutes over, but if you can come back at 11. But I was told, just as we were starting this morning, that Valerie Travers is not a person, it is the name of a business. It's the one that you order your clinical placement uniforms from. They have never done this before, but they are here on campus until 2 p.m. So if you want to check your sizing for your placement shirts, you can order them today. Even if you just want to check your sizing and order it online, they are down in the cafe.
Apparently there's free lunch.
Yes, apparently there's free lunch and slushies and stuff. Anyway, so we don't know what's there yet, but check either the uniform place out now or in the lunch break till 2 p.m, as well as have a break. But we'll see you back here at 11 o'clock. All good, team? Awesome.
Okay, all right. So, as Claire's already mentioned, my name's Alex, and I'm on the teaching team here. So I'll get to know you all a little bit more this afternoon, but more so I'm the topic coordinator for PMF. And I know many of you have already accessed the course page, so thank you. So we kick off next week for a pretty full-on 5 weeks. So I look forward to getting to know you all in that time. So just a little bit of background on me. I did my physio degree up in Queensland 13 years ago now, but from here originally, and then moved back home and worked in the public system actually for 11 years, and then I had a baby, and then I came back to work. So I've worked here and clinically for about 5 years. So I work 3 days a week here at the moment and teach mostly sort of inpatient orthopaedics, but I'm not as a generalist as Jill, but I do sort of throw my hand up at whatever, really. So, and that's because I enjoy every aspect of physio, so except peds, although I have a child. Don't give me a child to treat, I have no idea. Okay, we digress. So I'm here on behalf of Kelly Huxley, who's our placement coordinator, and that's because she is assessing neurovivors today. So there is a lot of content here. I'm going to try and get through it a little bit quicker than the 45 minutes that we had planned. But then any specific questions sort of relating to individual circumstances or whatever it might be, do sort of save those for another time. But I guess just to kick off, the goal of placements is that we want you to apply and consolidate your knowledge and skills in professional practice. And really, placement should be a transformational experience. That's what it is. So I've popped this up. This is a Mentimeter. So if you want to take that's a QR code for it. And that's just a forum that you can ask any questions on the content that I'll talk about now or what Claire has talked about this morning. So maybe just have that up ready. Hopefully it works. If not, the UR thingies there. What do you call it? I don't even know anymore because we just QR code everything. So it's the URL, that's what I'm going. So anything that you've got any questions, but as I said, anything specific or individual, please just hold that until you get started next week. All right, has everyone got it? All right, let's get started. So firstly, just to introduce the placement education support team. So there's, a subgroup within the teaching staff that will be looking after you whilst you're on placement. So Kelly Huxley is our coordinator, and then we sort of share it amongst all of us. So Jill Williams and Tracy, who you've already met, myself, Kelly. We also have Jared Strawbridge, who is basically in charge of all of our rural and remote placements. And I will just add that Tracy Radford looks after our Northern Territory placements as well. We've got Tim Morris, who's our coordinator for our Health to Go clinic, which is here on site. And we've got a wide range of clinical educators that will teach and support you in Health to Go. And most of you will have a placement down there over your 2 years with us. So you will get to meet all of those people in the coming weeks. So placement experiences here at Flinders, in total you will have 26 weeks of placement, and that's full time. So it's over 1,000 hours. You'll gain experience in the core and mixed practice areas of physiotherapy. The core areas being musculoskeletal, neurological and cardiorespiratory. Now you won't necessarily go out on a cardiorespiratory placement, but you might go over to Flinders Medical Centre where it's an acute inpatient setting, and you might get a mixture of all of those things. But we do, over the course of your five-week placements, do aim that you get a wide range of exposure and experience across those areas. You have varied practice settings, so you'll be in an acute hospital setting, you might have a rehab placement where patients are there for a longer period of time, and also out in the community as well. We also aim that you have placements across the lifespan, from anywhere from children all the way through to geriatrics. So you'll also have that exposure and also some differences in cultures as well. Our placement, so our program, we're accredited, and with that accreditation comes that we have standards that we need to meet about the types of placement and placement experiences that you'll have. So just to kind of let you guys know that we can't just send you all out on, 5 sports physio placements. We've got key areas that you need to be experiencing across your physio degree. And with that, there's competencies that you need to meet as well. So our key placement partners, here at Flinders we're really lucky. We've got so many really cool options and opportunities for all of you, and every year we're developing relationships with different partners. So SA Health, which is the public system here in South Australia, we've got Inpatient hospital services across the board. So we've got SALN, which is the Southern Adelaide Local Health Network, and that includes Flinders and Noarlunga Hospital. We've got a lot of placements there, which is excellent. We've got Carlin, which is central, so that's Royal Adelaide Hospital and the Queen Liz. And we also then have Narlan, which is Northern Adelaide. So we do have some good opportunities in all of those areas, which is great. Not only do we get inpatient hospital placements, we also get some outpatient and community placements from those guys as well. Jared looking after our regional sites. We've got pretty much everywhere. So from the Barossa and the Hills, Fleurieu, across to York Peninsula, Eyre Peninsula, you name it. We've got some private hospitals, which recently we became partners with over the last few years, which is excellent. So we've got Ashford and Flinders Private, Community Disability, so we've got Novita, Brain Injury SA, Multiple Sclerosis Society and Neuromoves. Aged care and community providers, so we've got some great relationships with Southern Cross Care and ECH, and private practices, which Matt Hocking, who hopefully you'll meet this afternoon, he's been doing lots of really great work on developing this. So we've got some cool relationships with Leading Therapies, Ranella Sports, Physio Extra, Physio Smart, Physio West, and heaps more. As mentioned, we also have lots of other regional placement opportunities and also up in Northern Territory, so Darwin and also Nhulunbuy, which I'll talk about shortly. And Claire, jump in with anything. So for those of you that are new to our state, just a little bit of a map, a bit of geography lesson, and also the one on your left is a map of, I guess, how our hospital system, I guess, is sort of broken up. So as already mentioned, Narlan there being Northern Adelaide, Carlin, Central Adelaide, Sarlan, Southern Adelaide, and then Country Health SA is kind of the rest of it. And then our different regions. So, try to orientate yourself to our beautiful state if you aren't from here. Health to Go. So this is our on-site clinic, which only came to fruition, 5-6 years ago? For physio placements, yeah. So we've been really lucky to have, lots of placement opportunities down there, which is great. So we've got Tim Morris, who sort of leads that up, and lots of us support and provide, education down there, which is really cool. So it runs like a private practice sort of setting, but also there's a paediatric service starting up soon, and it's also interprofessional, which is great. So we've got all of those other students that are involved too. Northern Territory placements, I can't talk too much to this because it's kind of Tracy's baby, but we do have placement opportunities across the year in Darwin, but also Gove Peninsula, which is East Arnhem Land, and that includes Nhulunbuy, which I know Claire had some photos up earlier about that. And that's such a cool experience. If you can get that way, it's so worth it. So I won't talk too much to that, but certainly more information will come out about those placement opportunities when we start getting preferences and things like that from you guys. So I know Claire's already showed you this table, but I just wanted to sort of demonstrate where the placements kind of fit into your calendar. So your first year, you'll have a 1-week placement that does fall under your PMF topic, but that placement doesn't occur until June. So you essentially do PMF, MSP1, then once you finish that, you'll go out on your 1-week placement. That 1-week placement, there's 3 weeks in June that will then allocate you one of those weeks. So I would just recommend keeping those weeks free for the time being, and we do aim to sort of let you know, Kelly and I are aiming for sort of early May to be letting you know what week that you'll be going out on placement. That week placement, I don't want to label it as observational because it's not, because you've already completed a lot of skills in PMF and MSP1, so you will actually get some opportunity to be hands-on, practice lots of your communication, and just gaining a really good understanding of the environment that you'll be in. And those placements will be a mixture across the board, so it'll be some inpatient hospital placements, private practice, health to go. Really, all of our placement partners tend to offer us this 1-week placement. Then at the end of this year, you'll have your first 5-week placement, which we call early practice. So we call these ones early practice placements. And that will be National Block 8 and 9, which is generally like October, November, and then finish by early December. So as Claire's already mentioned, the timetabling and enrolment nightmare that is for us is working out where you're going and what block you will be going in for that, but that's where that does sit. And then in your second year, I'll show you on another calendar, I think on the next slide, that hopefully gives you a little bit more insight. But in your second year, essentially you'll be completing 4 5-week placements. This one. So this is the calendar, and sorry it's really small, that Claire did pop up earlier, but I guess I just wanted to highlight that. So you can see in your second year, we've got all of those national blocks. So that's what, I think WA do follow national blocks now. Yeah, I think they're now no longer going rogue. You, across any of those 8 blocks, you essentially have 4 5-week placements across those. So you will have a mixture of placements in sort of first and second semester. And we do sort of we will take some preference surveys fairly soon actually. But yeah, I guess just for you to be aware, you might have some blocks that you might be here for teaching, then on placement, vice versa. It is kind of a little bit mixed across the year. Is there anything to add for that? Tangled up.
No, I don't think so. I guess it's just sort of us giving you that sense of what the study load looks like, so you can really pace yourself out, because when you're not on placement in final year, you've got other like assignments and work that you're doing that you can work on. So it's kind of how you build that across the semester. And even at the end of this first year, if you are in what we call National Block 8, which is that one from the 30th of September, it doesn't mean that you finish for the year. We all finish in the same at the same end of the week. You're doing other sort of work from the cardio topic and the PCP topic. So you've got content to do. It just looks a bit different.
And some of it you'll be on site as well.
And we all still finish at the same time, even if that last 10 weeks looks a bit different at the end of this year.
Yeah, hopefully that makes sense to everyone. It is a little bit confusing, but I promise it does. We kind of keep going over it, I think, don't we? So. Okay, so placement logistics. So they're 5-week full-time blocks or equivalent. We do have some longitudinal opportunities that might be across a longer period of time, and you might attend 3 days a week or whatever that might look like. But we would be in negotiations with you and our placement providers, I guess, about that. Compliance is critical, so I'm going to get to that shortly. If you aren't compliant in time, you don't go on placement. Then you can't complete placement and be successful. So we'll get to that shortly. Varied scope of practice. So you will experience a bit of everything. So all of these are roles of being a physio. So not only is it one-on-one patient care, it's attending meetings and planning, participating in some research projects, potentially some small-scale projects whilst on placement, providing education. Your site might ask you to do a little project on a particular area of interest and present to the team or whatever it might be. So it's not just being on site working with patients the whole time. And also while on placement, there's an expectation that then you'll be also completing individual work, coming prepared the next day. So I will get to shortly around the question of can I work while being on placement. We'll get to that in a minute. There is a preference and allocation process. So on that, so we'll be putting out a survey, gosh, I'm going to say in the next sort of 4 to 5 weeks, that will be looking at some preferences for CP1 and your placement at the end of the year. We can't promise anything because, of course, as already mentioned, we need to make sure that you're, getting experience in all of those core areas. But we will be looking for expressions of interest and preference to go rurally or remote and Northern Territory in the first instance. So if you're from any of those regions or have family or whatever it might be, certainly do let us know. And then we'll be asking sort of what your general interests are, and we do try to map that as best as we can, but do appreciate that it's a logistical puzzle, and also we only have so many opportunities with different placement partners. Anything else on that?
I think that's it. It's called preference because it's a
preference.
It's preference. Yeah. So I think sometimes we found in previews some of that messaging has kind of got lost. Like, we will do everything we can, and I know that it's asking you to trust us with a lot. And look, sometimes you won't get allocations that are necessarily convening or things like that, but yeah, we will we will absolutely do our best, but it's a preference. I guess the other option is that we don't ask preferences and we just put people out everywhere, and we don't think that's a really great way to work with you either. So we're hoping it's a fairly good middle ground in that sense, and that we'll try and match up as best we can, and that's something that we do tend to do here at Flinders that we know other universities don't necessarily have capacity to do, because they just tend to put people in. So we hope that's helpful in our program, about how we try and manage that.
And I know Claire's already mentioned that we have some really cool interprofessional sort of supervision opportunities where other disciplines might supervise you and vice versa. So that's certainly something that we have a big focus on here at Flinders, and you're going to learn lots about it in your IPP topic. So now, rural and remote placements. So students sort of to complete at least one rural or remote placement during their time here with us at Flinders during the course, but of course there are some conditions around that. Rural and remote placements generally are considered more than 100 kilometres from Adelaide, so that doesn't include Mount Barker or Gawler. And outer areas like Strath, Victor Harbour, Galway, Murray Bridge are within 100 k's, but we do actually have some university accommodation and supports available with that. Now, Jared is your go-to person for all this rural and remote stuff, but as mentioned, if you're from any of these regions and for that CP1 placement you think, yep, I can go and do that there, certainly do let us know when we put out that preferences survey. And similarly for your placement at the end of the year. Northern Territory is considered rural and remote, of course, and as mentioned, I won't bang on about the preferences things, we've already talked about that. If your preference is to do multiple rural placements, we will welcome that as well. So if that's something that you think, yeah, I want to be a rural generalist, now going rural is such a cool experience. You will get to see a bit of everything, because often the physios on staff don't just work in cardio or outpatients, they will see everything. So it is quite cool to experience.
We've been able to do back-to-back placements on occasions for individuals as well, if you're that keen. Like if we could find an SA Health and a private practice, then instead of go for 5 weeks, you could essentially spend, a few months out there or something like that. If there's a region and an area really interested in, just let us know and we'll see what we can do.
Mm-hmm, definitely. Now, a couple of FAQs. Can you continue paid work during placement? I'm going to actually ask Mitch when he comes back in, who's one of our second year reps, to actually answer this question for me. It depends. It depends, A, what your paid work is, and it also then depends, I guess we want to stress that placement is an assessment item, so it needs to be considered like an exam or an assignment or whatever, and it is, it's going towards your grades, it's going towards the completion of your program. So I think you really need to think about how that will work, in the time that you're not on placement or on break, that you're working and trying to save a little bit of money, to put that aside, to then ease the pressure off when you are on placement, whatever that needs to look like. But, I think it's worth looking at the next 2 years and trying to work out, okay, how can I make this work to try and ease that working load when you are on placement, because you'll be doing a 38.5-hour full-time week while you're on placement. So to then be going and working, a 5 till midnight shift on a Wednesday night and then rocking up to placement the next day is going to be pretty unachievable. And we have had students burn out and then not be able to complete placement, and we don't want to see that. We want to set you up for that success. So I think have a really good think and plan what your next 2 years look like in that. Anything else you want to add to that, Claire?
I think it's consistent with what I said before. There's elements that are tough, and we understand that. But I think at least if we can sort of say this is what it's looking like. But look, if the university does have sometimes things like some of those financial grants and scholarships as well. So there are other things that aren't necessarily based on, in fact, they're not based on any academic performance type things. So there is financial counselling and other supports up the hill as well. And so I guess that it's a bigger system that we're here to support around that. And we know that that's, and sometimes you've got to do what you've got to do around that. But at least if we can kind of give you the clearest picture we can, then it allows you to sort of work out what you need and then to sing out to us if there's any other ways we can help connect you, or if we do need to make
And I guess on that as well, we try to give you as much notice as we can what block your placements will be in, so then you can then plan that little bit more. So I think, we released placements, towards the end of last year for the whole first semester, so then our second year's had a bit of a chance and opportunity to kind of plan and, work out their lives around it. So we do sort of respect that as well. So next question, can I approach sites that I'm interested in placement with? please don't. Only because come to us and talk to us first. So I don't approach them in the first instance. It could be that we know them already. They could be a partner of ours already. Physiotherapy in Adelaide's pretty small, so we often will have connections, and we can, if it's something that you're really keen on, we can try and source things, but there's a lot of intricacies around insurance and agreements and all this stuff, so do just come and talk to us first if there's something that you want us to explore, and then we can sort of take it from there. If I have concerns, what do I do? So I think we're pretty much an open door team. Like if you come up to level 4 and walk around, all of our office doors are open, so please just come in and have a chat if you're at all concerned. Claire, obviously, in our course coordinator role, myself as student engagement coordinator, but also topic coordinators, anyone on staff, hopefully we can provide the support that you need or point you in the right direction. I think that's probably what I'm getting at. Preparation. So part of PMF, we actually have a preparation for placement workshop, which sits in May. The timetable is a little bit odd, but it sits within your MSP topic. So we'll all be together. I think it's in this room actually, and we'll be talking about how to best prepare and set yourself up for success on placement. So don't worry about placement just now. We'll talk more about that as the time goes on. All right. Plan early. There will be a course information page that does appear on Flow, and in that will be a placement module, and it will have lots of information in there. It's not yet live, but it will be in the next probably 2 weeks.
When Claire does it.
When Claire does it.
And works out to get you how you're all added. I'm close.
Yes. Now, our WIL team, or our Work Integrated Learning team. So our support officer is Chris Ariskog, and she's the one that will be ciphering through all of your compliance items, getting you set up on in place, getting you set up on whatever else you need to get set up on. She's more than happy for email inquiries to be sent directly to her. So her email, this presentation will go up on Flow, but she also she sort of looks at both emails, so her personal email and the CNHS placements email. So any queries about compliance items, please go to her. I don't know heaps. None of us know too much about that stuff. She's the person, really.
If you've got questions about my police checks not coming, like who do I apply, that sort of stuff, how to work through that.
Or if you're not from here and you've got, there's some complexities, and she's sort of across that. So placement requirements, it's your responsibility to ensure that these are completed in date and time for your placement, which I'll get to the cut-off date for that shortly. It's not only just a university requirement, but a site-specific requirement as well. So some of our sites, like for example Ashford and Flinders Private, they've got a whole separate set of compliance items that if you're going to be placed there, you'll have to act on those. Failure to meet or maintain compliance may result in cancellation of your placement, and therefore affecting your topic completion. So this is something that before you start PMF next week, in the next couple of days, I'd look at the compliance list and make a bit of a plan for how you're going to tackle some of these items. The checklist, which lives on that website, but hot tip, if you just Google Flinders Uni Physiotherapy Compliance, the website comes up. It looks a little bit like this. So I'm not going to go through everything. It's pretty self-explanatory, I think. A couple of the items we'll be ticking off today, the fitness for placement, student consent, all of that stuff. A couple of things you'll be doing in PMF, such as hand hygiene, so you will get some of those things, but the rest of it, this checklist is your go-to. So this is what you need to be working on and have it completed by the 1st of May. That's your cut-off for that. So, which is what, 2 and a bit months. So first aid, all that bizzo, you need to start locking and booking that in to have it all done. And that is so you're ready to start placement on the 10th of June.
Yeah, just for background, we have to confirm with sites 6 weeks before placements start. Otherwise, they've actually got no obligation to offer us the placement. So I guess that's why we need to check that and have that here, because otherwise, essentially, as the university, we haven't fulfilled our requirement to give adequate notice to the site. So that's why we can't risk them sort of saying, actually, no, Flinders, you weren't organised enough. we
And
need
I
to be on the
think
front foot.
too, just to stress, this isn't just a university thing. This is, Claire and I are registered physios with ARPRA, our registration board. We have to also do these things. So you're doing them now. You'll then have a few things that you'll need to redo in second year, but then you'll be able to, once you're finished, be registered as a physio and have all of this stuff ticked off. So it is kind of setting yourself up to then progress into working. So
There's nothing on that list that is beyond what is essential for our partners and what people in workplaces need to do. Yeah.
So Chris Ariskog, she's going to be, I think she's actually emailing you all today. So if you do check your uni emails, it'll be on your uni email. So she won't be contacting you via your personal email addresses. So if you haven't yet already accessed your university email, please work out how to do so, because that's how we'll communicate with you. But she'll go through how to upload all of that documentation into InPlace, and that's then how we allocate placements to you, essentially. So, yeah, that's all that slide says. We've talked a lot about that. Placement uniform. So as Claire's already mentioned, which is cool, Valerie, Travers are downstairs. So I don't know, I'd try them on and just work out what size that you need. So it's the university polo. There is also a vest, which a lot of the students do purchase. I used to wear a vest when I worked clinically because hospitals are pretty chilly places. So, and just having pockets, I used to shove heaps of pens in my pockets. So whatever works. You'll also need to get a physio student name badge. Now, it's not your ID card. It actually won't have your last name on it because that's not something patients need to know about you. So that you get that up at main campus, I believe.
If you go to the compliance page, it'll tell you how to order
how to get all
everything
of
you
that.
need, the uniform and the badge. So, yes, double check the badge.
Now, the polo shirts are navy, so we would recommend navy trousers that are nice looking, in saying that you want to be comfortable. So we don't want to be wearing tights, no active wear, none of that stuff. They need to be like a nice tailored pant, something that you can move pretty freely in. If you come to placement in the wrong uniform, you'll be sent home, and it's not a good professionalism look. So do sort of think about your uniform. Also, in terms of shoes, a lot of people will wear like a black trainer or black sneaker. That's sort of not too sport looking, but sort of, like Skechers or any of those sorts of shoes. But do also be mindful you're in a hospital and there's bodily fluids and stuff that can leak. So I always actually wore like a leather kind of shoe. So just have a bit of a look over the next little while before you go out on placement and get something that's really comfortable. You're going to be walking a lot. So that's probably my hot tip. As mentioned, your name tag is also then a form of identification as well. Uniforms, please order your uniforms early. So if you tried them on today, pop in an order as soon as you can. We do also have an expectation that when you come on site for any practical exams or assessments that you come dressed in your uniform. That's just so you're immersing yourself in what it's going to be like when you're on placement. So if you don't have your uniform in time for your first exams, don't panic. Just wear something that's sort of, professional looking, nice looking. Fitness for practice. So this is really, really important. If you have an existing condition or develop an illness or disability that may impede your fitness for practice, you do have to declare it to us. Similarly, if you're working as a physio, we would have to declare it to the registration board. There's a form that will live on Canvas, Flow, whatever we're calling it, Flow, which you would need to complete and also then have a medical practitioner sign off on that as well. Not only is it fitness for practice on placement, but it's fitness for practice to participate in practicals and assessments, and not just for you being the therapist, but also then you being the patient as well, so having your peers practicing on you. I think in the consent form, that's what that's about.
Just to clarify, I think there may be perhaps clarify two different forms. So the form I've got for today is about participating in the practical classes that we're doing. The other form about fitness for placement for compliance, I think, is actually a different form. So they are slightly worded differently. And I guess the thing is, if there is some sort of condition or something that happens that changes your fitness for practice, there is a recommended form that you could get the appropriate person to fill out, whether that's a GP or like physio or something like that. So keep in mind that can be a range of things that may be, sorry, this is awful, that might be longer term, in which case if you have an access plan, which you do through the University Health Counselling and Disability, that makes that easier for you, because that means that there can be reasonable accommodations to your study plan, and that's much more helpful if we know that, because we can look early and go, okay, and then you don't have to sort of keep going over different documentation and things. So that's meant to make things easier for you and to make sure that we can support you in your studies. But at the same time, like we know there's a few, not singling anyone out, but there's injuries around, and look, we've had students that have broken their wrist before cardio and can't do percussion. Like, there's other things that will happen that may be more short-term things. And just like a workplace, we need to keep you safe and kind of know what are the restrictions and things like that, and how can we do that. And then usually we'll get some sort of clearance that you can return to other duties, or if there's modified duties, that's a conversation that we need to have, because some placement sites may be able to accommodate or not, depending on what the type of placement is.
I guess
so
this isn't if you've just got a cold or COVID or whatever. This is for something that, you know, is going to really impede your practice, and it's not just a day or two off or whatever it might be. It's something that's, could impact on your safety, your patient's safety, all of that stuff.
Yeah, so. But essentially that's declaring, and it says on the form how often you need to do that fitness declaration, but it's essentially, it's almost like a rolling thing, kind of each placement. It's worth having a check-in for yourself. Is everything good to go? Or if something comes up, it just keeps it front of your mind from there, because you need to be safe where you're working as well. We don't want to have you making anything worse by doing the placement work or things either.
And leading into that, as Claire's already alluded to, health and counselling and disability services are fantastic here. They are up on main campus, but I believe that they're starting a remote sort of service here down at Sturt, which is really cool. So again, if any of that fitness for placement stuff comes up, these guys are just good to talk to around it. It's just some free and completely confidential and anonymous advice. So they're also a really great service.
Phone and online stuff they can do too.
And
so
they
just
do
because
like
you can't
24
physically
hours.
get there, you can access it in other ways.
Okay, what do I need to do now? So over the next couple of days, I'd recommend getting started on your compliance. So hand hygiene and infection control. We do want all of this done, those two things done for your first practical on Tuesday with me, only because you're going to be getting hands on each other, and not in a weird way, that came out strange. But yeah, we'll be encouraging obviously hand hygiene and your 5 moments of hand hygiene and all of that sort of stuff. So also Claire's going to orientate you to the prac room this afternoon, so around cleaning equipment and all of that kind of thing. Also have a look at some of your other priority items as well. Familiarise yourself with the placement website and its content. The compliance website I'm talking, the course information page, we will let you know when that's up and running, but certainly if anything pops up in the meantime, I'll be in your prac on Tuesday, so you can always come and check with me. Order your uniforms and your name badge, so just check the information on that. And if Chris Ariskog emails you about the compliance or work integrated learning stuff, please do get back to her as soon as you can. That's quite important. We've had issues with that before, where Chris is sort of sending pretty important emails and they're getting missed. So if you haven't got access to your uni emails, please seek some support to do so. Okay, do we have any questions on our Mentimeter? I can have a look. I think I've...
That can be from first part this morning too.
One question. Oh, hang on. 3? How do I look at all of them? View results. Here we go. Loading questions. Okay.
I'll just say, while Alex is loading that, on the compliance thing, the things that people tend to find trickiest is getting your immunisation status done. So finding your old immunisation records and getting that signed off. There is a form that you can get signed off. There are GPs, general practitioners, up on main campus too, so they would be very familiar with how to fill in the forms. If you've got reports from blood tests, keep it and get the serology, because Ashford and Flinders Private Hospital do want a deeper layer of that information. So getting that documentation is a common pressure point. And particularly, I think it's Hep B tends to be tricky, because there's 3 3 different immunisations you need to have, and over a period of time. And we appreciate that wherever you're up to, you may need all 3 or none or whatnot. Usually to kickstart, if there is an issue with someone not having met that requirement in particular, we need to then check with the placement site that they would be okay, but at least have a plan in place for when that's going to happen, and then we can backtrack from there. So because of the time frames, they're the ones that tend to be hardest to get. And some people with their physiology, they just don't build antibodies and don't seroconvert, and there's nothing you can do about that. But again, in which case, at least we're aware, and the placement site can put in risk management procedures as they would from staff to make sure that that's safe for you. The other ones is like trying to find a first aid course or something, but I reckon Mitch has emailed me about trying to book one in, so he may have preempted that for you and be organising one that you could book into here. And I think there's another one, the safe environments training through their eyes can sometimes be tricky to find a session time that meets. But again, if you run into trouble with that, fitting it in with the semester,
you do
sing out to us.
You do have a week off between PMF and MSP1, so that's often a nice little time to, although you probably want to go on a holiday, which I understand, but just also think about booking some of these things in maybe for that point in time too.
Because most other stuff, it's like online form stuff, so you can get it done, but those are the things that are reliant on other people or systems, so hence you want to plan a bit more.
Sorry, I was just going to quickly say, one of them, I think it might have been the Through Your Eyes placement thing. I tried to get it started a while ago, and it needed some information from the uni, I can't remember exactly off the top of my head, but it needed some things that we had to get from you guys. It's like the course.
It's like a code. Yeah, there's sometimes that. Yeah, sometimes there are things. On the placement page, you've got that checklist and it takes you to links, but on the other page, it's also got some other detailed information from some of the drop-down things. Have a look in there or ask Chris.
I reckon Chris she was going to plan to email all of you, so I wouldn't be surprised if she's got that stuff up her sleeve.
Because the only other common things that come up is sometimes with the police checks is some placement providers are really particular about the very specific wording about what settings. So again, if you can check with Chris or go through some of those systems, and she can help follow up the applications and make sure the wording's right to avoid you having to apply multiple times. Yeah, you're right. So it's there are some.
Yeah.
So you just have to be a bit attention to detail, and I know that it's painful, but
yes.
Yeah. Sorry. Any other questions?
Yes. Can you have placements back to back, or is it placements for 5 weeks then teaching for 5 weeks? Good question. In first year, it's pretty much teaching all the way through till that kind of end of September block. And then you might have 5 weeks of partial teaching here on campus, then go on a 5-week block of placement, or vice versa. In second year, so as an example, the students that are doing their examinations today have just been on a 5-week teaching block, but that was only half of the cohort. The other half have been on placement, and then they switch. So that's kind of the case throughout second year. You may have a block free, but as Claire's already mentioned, there's always project work, or there's something that is sort of overlapping in terms of assessments to complete.
But yeah, it's quite common. I won't use a double negative, not uncommon. It's quite common to have back-to-back placements. So maybe in that first year, you might have neuro placement break, and that might be what it looks like. Or you might have neuro placement break placement, and then similarly in second semester. So back-to-back ones.
I think it's you and I that are like,
yeah, sorry.
So, So that's Chris Araskog. I'll go back to the slide in just a tick. I'll just answer these questions. But if you head to that placement compliance page, all of her details are on there as well. But I'll flick back to that. Is the transport and accommodation to rural areas provided by the university? We have options.
There is a specific rural accommodation, rural placement support site through the university, and that does also link, if you go to that placement compliance and physio placement pages, it'll link you through to the right ones from that. Essentially, yes, the university does own a range of accommodation in most of the regional areas, and Jared works very hard to sort of look at placements where we know Flinders has housing, and therefore they're the regions where we've built relationships to have placements. It is often like a bit of a booking system, so this is why we try and organise them early, because then you would then go and put your name down with the rural for the accommodation, and they would confirm and sort that for you. Yes, there can be some other costs around that, but usually it's very subsidised for that university accommodation. And there's also information on there about travel reimbursement as well for fuel or bus, or however you decide to get to the region.
You won't get a car, or you won't get access to that sort of stuff while you're on placement. So it'd be, once you're there, your own transport around.
And similarly, Northern Territory has got similar things as well for if you've got placements there, university accommodation, and
reimbursement.
Then also reimbursement for flights and things like that as well. So,
Jared's the person, and as I've mentioned, once we get that preferences survey out, that's when we will then come to you and say, hey, you've indicated that you're keen to go here, let's explore that a little bit more. Are rural placements required for international students?
This is a
tricky
good
one.
question, and it's really tricky. And I'm going to sort of try and just be really honest with you about how and why it's tricky. Look, in terms of the mix of placements, sometimes we don't have enough rural placements for everyone to have one, but it is an important part of our program for everyone to be able to go. But we also appreciate for international students there are some unique challenges for you in that there are differences in terms of who can access that university accommodation and reimbursement and things like that as well. So I guess we're sort of trying to tread this line of kind of, if we want to go to a region, how can we support you to go there? You still may want to, but there are differences in terms of what you can access. And so I guess we're trying to also think about, well, what does that mean in terms of how we balance that out in terms of the cohort and things as well. So I know that's not a super clear answer, but we are aware that there are differences in terms of not being able to sort of, particularly the Northern Territory placements, to necessarily access them. Regional South Australia more so. It's not that we can't do that. If you're really, really keen to go, you should absolutely ask the question and let us advocate on your behalf for that. But we are aware that there are some differences in terms of what that means in terms of funding and things like that. That means that we probably try to sort of make sure we balance that out so that if someone really can't go and doesn't need to go, but we also have processes for how we try and make those decisions transparently for everyone as well. Because they're an important part of the mix of the program and experiences.
It's a cool thing to do. And last question, is there a possibility to create a placement partner outside of SA, for example? So we have done that before. We had a couple of years ago, we had a student from down in Tassie, and we did explore some opportunities down there. And again, it was kind of because someone knew someone that we could sort of build that relationship. As mentioned, don't approach the site, whatever it might be, come and talk to us about it first. So it could be that we already know people, or we already have something in the works, but as said, there is a lot of intricacies to developing a placement partner around, making sure that the site or person is happy to have the responsibility of students and teaching and learning, around assessment, insurance, all of that sort of stuff. So the answer is not no, but it's not yes.
Come and talk to us, because
come and talk to us.
A premium everywhere around the country, and you look into Victoria, for example, where there are lots of programs, and so us trying. But we also are highly collaborative through all of the placement coordinators sit on a national group of placement coordinators that talk to each other, so we do know the placement coordinators at all the other interstate universities, and sometimes, it just so happens that things work out as well. They have somebody that's from SA that wants to come back here, You never know your luck, so it's worth asking the question. It's not part of our normal kind of offerings or what we expect, but you should feel free to ask us, because, you just never know what else has happened to come up and get lucky.
Yes. That's the information for Chris, the compliance person. And so she monitors both emails. So use those as you need. Keep an eye out for the email from her in the first instance. So maybe don't go diving off any emails to her right now. Maybe just wait to get the information first. And that's it from me and you.
And most of the questions.
Yes. We've got Mitch.
And Sasma. I'll just double check out there.
Yes.
I don't know if I haven't checked if Danielle's
so
out
Mitch
there.
is our...
A question
I can
as
see
well?
it. I can see you, Mitch.
Thank you. Question over.
I think there were a few questions on the menu that might have been missed. There were some about CPR.
It could be that it hasn't updated. Oh my gosh, there's many more. Thank you. No, that's fine. Let me just have a quick read. So first aid, First aid, we don't organise it.
I think first aid is, we took that off the list and went just CPR.
Yes.
You'll need first aid if you're doing like the sports training
Mitch
stuff
is
like that,
nodding.
other things, but we really pared the list down.
Yes.
Because we're aware that whenever there's a cost with that, like what's the minimum that we can get you through around that? And so it's
Yes.
the CPR, so I'm pretty sure the more comprehensive first aids, I'm pretty sure it's off the list
Yes.
now.
It's required for Northern Territory.
Oh, required for
Applied for Northern Territory. So there is some site-specific things. So CPR, so that's sort of the same. Are we still going to go through content during placement? So whilst on placement, I guess actually that's a really good point. There's nothing content-wise at the university, so there won't be lectures or things like that on your timetable whilst you're on placement. But the expectation from your placement site is that you're reviewing content related to patients that you might be working with, but, you know, coming prepared. You might have seen a patient today and you're going to plan what you're going to do tomorrow. So there is still that level of work and proactivity needed from you guys. But no, there's no formal content whilst you're on placement.
And particularly in the early placements, the providers, we think, are pretty good at recognising that you need time to process and prepare for your placement. So as much as possible, we'll encourage them to build that into your day. Or if you've got an hour free at the end of the day and they go, oh, great, you finished your patients and your notes, then that's some time where you can start preparing for the next day. So placements aren't, I mean, I think Mitch and sort of team would be better to comment on that, you know, when you get to chat later on, but they're not always like go, 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 go. There is often time
Some downtime.
to
Call it
access
sort of
that
cold
preparation.
learning time.
Yeah.
International student, we've already sort of addressed the rural placement question. There's a question about Iran EC. I'm not certain what that is. That's a question for Chris Araskog or the compliance team. So whoever's posted that question, thank you. But if you can ask Chris that one. Essentials to bring with you to placement. Good question. A notebook, something small that you can carry around with you, and of course a pen. Any placement, any materials from your content that you think you'll need. We obviously let you know when we allocate you a placement. Say, for example, I've got students going out to Flinders Medical Centre next week. They already know what area of the hospital they'll be working in, so they then might come prepared with course content. I guess the silver lining is that everything's online now, which is really cool. So, but you can't sort of rock up with stacks of stuff on a hospital ward environment. A, it'll probably go missing, but B, from an infection control risk as well. So, but no, packed lunch.
Yeah. I don't know how whether anyone from your group is you use like the physio pocketbook, but there's we've got very few recommended textbooks, again, because so much of it's available online through the library. You can buy textbooks if you like, but again, we've tried to, I think pretty well, we don't have any textbooks you have to purchase in the Masters because we've tried to keep it fairly cost effective and bare minimum for you. But some people do like this little physiotherapist pocket book because it is small and it's just got some quick reference pictures, like if you just want to remember your dermatomes, your myotomes, your auscultation zones, some really quick stuff for knowledge. Some people like that.
Now, just quickly, because we've run a little bit over time, question about international student driver's licence. Yes, in the preference survey, transport is a question that we ask, so that's something that we will take into consideration. But also on the flip side, do let us know when that changes, so then if you do get access to transport, we can then look at things. So black pants, okay, yep, that's not a problem. Black or navy's more than fine. And yeah, I think that's all the questions. Mitch, quick question for you. How have you found managing work whilst on placement?
Working on placement is definitely challenging. My last placement, I think my second week, I worked a 26-hour week on top of placement, and it nearly killed me. I think try and keep it to a minimum. You've obviously got your weekends, but if you work after placement, which I did a few times, it's like a really, really long day. So I think try and keep it to a minimum. You do, as the guys mentioned, you do have some work on top of your placement as well. So you've got, some uni work to do as well. So I think, maybe just keep it to weekends if you can. It does get challenging otherwise. And you burn out pretty quick.
We're going to hear more from Mitch very shortly, but we've got Danielle Grant-Cross here. Do you want to have a quick sort of 5 sit-to-stands on the spot or something like that if you need a little bit of a stretch before we hear from Danielle and how he partnered with SASMA.
Hi there, how are you? It was amazing to find you. Yeah.
Oh yeah, it's a rather
I know it's guys on the top floor.
Yeah, and I know it's an awful room and building, but at least if we're the same as last
I
year.
know. As I said to the people, I went to the lady, it must be Winter's up there, and I'm like, I know it's this end of the building, but I just can't remember where.
And Jared was keen to come down, but he has a meeting because he was just annoyed that I booked you in for the 1 hour time slot, but Jared's not available. And I was like, hi, but he was keen to come down.
Okay, yeah.
Do you want me to hand anything out?
Yeah. So this is we've got a conference, and we've just come out and we're just going to do $50 tickets for uni students, which is a bit of a steal because it is high, and even Jared is so it covers our costs, cabling. So that is good, and that's a big thing on concussion. And as you know, we've got, just see he's the chief medical officer from and then we've got a little workforce, which we did last year, and uni students for real which is really good. And then someone here, I can't remember, Mitch, someone.
Yes, that's Mitch. Yeah.
Oh, this is Mitch. Oh, he's doing he's asked to do a taping.
Yes.
You're the man.
Pictures all over it.
But our toner ran out, so we've only got so many.
That's okay. I can either take them out and then put also this afternoon because we have other smaller groups.
Yeah, so you can.
So we can have a minute to distribute them out from there.
No, so do you want to roll?
Yeah, let's roll. Are you happy to roll?
Yep.
Yep.
And where's the clicker?
I've just been using
fine.
flick along with the mouse set, or I can flick along with you if you like.
All right. A little bit of a sort of jiggle and a wriggle. We have Danielle Grant Cross here from SASMA, as we look forward to hearing how you can sort of, for those of you that particularly have an interest in sport or are looking to do sports train and other type work and really build your skills in CV, can engage with them that we love working with. So thank you.
Thank you. I'm just going to wait till these lovely gentlemen sit down so then we can all get on with it. And I know you're hanging there because I know you've nearly got lunch and it's yet another person speaking, so I'll try and be a bit different. I'm not from the university, I'm from somewhere else. So my name's Danielle Grant Cross, I'm the CEO of the SA Sports Medicine Association. You're going, well, why are you here? What's that about? We're the peak body for sports medicine in South Australia. So we essentially get government grants to deliver concussion, to deliver community education. We've got members like you, so we have professional members, orthopaedic surgeons, physio, sports docs, physicians, the whole range. We've got a few hundred members and we've got a few thousand sports trainers. Who here knows what a sports trainer is? Yep. Okay, excellent. So we have a level 1, level 2 qualification. What else am I missing up here? I should talk to you what else we do. So we work a lot with the Minister. I've been chatting with them this morning around all things concussion. We also manage events like, before I get onto the trainer things, the Tour Down Under. You all will probably be aware, if you're from here, about the Tour Down Under. So we manage that and provide the medical support. So we have a couple of race doctors and then we have sports trainers on the ground. Often the sports trainers that we employ, because you get paid to do it, are often allied health people as well as a sports trainer, because it's an added bonus for me to have people that have other qualifications or are working towards that. So you can be paid as a trainer. So remember that. That's an important thing. We also have things like Masters Games. We actually had a lot of, I think it was some of your students were involved with the Masters Games last year. Mitch, you were one of them. We have often around 60 trainers. So getting your qualification as a sports trainer, it's a one-dayer, it's a no-brainer. You do it with your eyes closed, but it's still different to physio. Because what we find is all of you go on placement, right? And then a club says, hey, making up a name, hey, Kate, you're an excellent physio student with us, we'd like you to stay on. And you say, hey, that sounds great, all the rest of it. What you find, they said, come and be our trainer. They use the word trainer, come and be our sports trainer. But you're actually not a physio yet, as you know, you're not through yet, and you're not yet a sports trainer. So there is a bit of a gap there that you could be exposed. So we're trying to make sure that you do get some qualification. I do jump around a bit, so stay with me. So I might jump to the next slide. That just gives a little visual, right, of what we do. We run education. We run 4 allied health events, 4 professional member events a year, and we have a conference coming up. And Claire has got the form around the conference. So the conference coming up is on March 3rd. We've just going to release $50 tickets for allied health students at university to attend. Normally it costs a couple of $100. We've got a couple of people from Flinders that are on our board, and they said, hey, students can't afford it. I'm like, okay, let's make $50 tickets. That covers the catering for the day. Who is speaking at that? We've got a keynote speaker coming from Melbourne. His name is Dr. Michael McDissey. He is the Chief Medical Officer for the AFL. You would all know what's going on in the concussion space. It's a really complicated space. People getting confused. Are they out for 7 days, 14 days, 21 days? What's happening? You know, there's a big move towards physiotherapists, especially neurophysios, helping in the rehab back from concussion. So it's a really interesting space. And I might flick over because I think we might have a flyer that tells you a bit more what we do. So we work with government, we work with the major sports clinics, we work with professional members and community to deliver. You know, really what we're about is how do we make sport safe on the sideline? That's really what we do. So we have trainers and people. Do you have a question?
Yeah.
Yep.
I was going to ask, does a Victorian certificate also translate here?
As a trainer?
Yeah.
Yeah, we do. So we are not part of national SMA, but we do have a relationship that we will accept if you, of course, within the time period, because you become a trainer, then you get re-accredited every 3 years. So we actually, I'm jumping around a bit. I should stick to the conference. Can I jump over?
Yeah, which
to
one?
the,
That one?
Yeah, this one.
Conference.
So this is the conference that we've got coming up. And whilst it's the first part is concussion, there are other things that we're also speaking about. So Claire has got some flyers I've left here. If you are interested in doing it, so it's $50. We've reduced it for all uni allied health students. I would suggest you get in quickly because we're just about to close off the books. There's about 100 people booked in. And so we're getting close to where we're going to stop soon. So if you are interested, no pressure, but if you want to do it, I would get onto it soon because it's only in just under 2 weeks' time, right? So that's the conference. I might jump over to the next one. This is a level 1 sports trainer. So to be a trainer, so who here is a trainer already? This guy is, a couple of you are. So you've gone and been accredited. Did you come out of interest, because I know you're, I think, from Victoria, did you come to the event we had in the city last year? Is that where you did it? Kidman Park, okay, so in our offices in November, excellent. So how did you find it out of interest? Yeah, it's good. It sort of gives a cover of sports injury management, so not soft tissue and all the other things you do, it's everything else that you look at doing. We have got subsidised funding from a group called Sport SA. It's another not-for-profit, and we can deliver the sports trainer courses for $135. They're normally $275. It doesn't happen every year, it doesn't happen all the time. So for $135, you can come and become a level 1 sports trainer if you choose. We have also got, and we might flick to another one, so in that you do things like taping, which I know you probably know what you're doing in taping. You do things like transport of an injured person off the ground, so you literally get the stretcher and you practice transport. You go through other scenarios where you have to problem solve and work through those, because working, as you know, in a consulting room when you get there is very different to on the dirty grass on the sideline and the ref has said, hey, you got 2 minutes to make a decision if this person is on or off, right? So it's a very different environment. So being a sports trainer does help you, we believe, when you eventually fully fledged physios, having the understanding of what happens with sports injury on the ground can only help you when you're actually practicing in your profession, in your discipline. So I was going to also share, I believe it is the 10th, I have to remember. So key dates, March 3 is the conference, heavy on concussion but also other things. We've got a couple of flyers, a toner ran out. This is our level 1 sports trainer course, which is only for allied health students. I think we're running, I haven't got my glasses on, I think it's April 10. It's in your first break. So we purposely have done it in the first break. We had about 50 students from the 3 unis that did it last year. Really well worth it, and it's also good because you're actually with other allied health people. So if you're interested, there might be one you might be able to fit in your holiday break, and it's a day, and we hold it in the city in a place called Karen Rolton. It's like a pavilion. It's in the middle of sort of grassy area opposite the RA. And also Mitch here has coordinated with one of my staff, Jack, to run a specific taping session. I think we're also doing in April. I don't know if we've got the date yet, but we're working on it. So, couple of key things. If you want to be a trainer, come and do the course. It's well worthwhile. I think it's a good investment for $135. Then you're accredited for 3 years. You have to have CPR and first aid, right? So first aid is every 3 years and CPR you have to update every year. Do you have to have that anyway here?
We're just saying it's CPR for here, but not first aid for here. But again, as Mitch said, some extra placement sites have got additional items, and so if you're going to the Northern Territory, you need first aid, and for you it's first aid. Just we tried to build that more choice and option in for people, but it's still a great skill to have as a member of the public. I highly recommend it, but in terms of the bare bones for other placements,
thank you.
But so I still recommend you get them because it links to your courses as well, of course.
I think it is. So to be accredited, you have to have those things. I think by memory, don't quote me, but I think it's around $100, I think, to do a first aid course, and it lasts you 3 years. It's just good that you've got it, and obviously you've already got your CPR as well. So what else have we got? So what have I talked about? The conference, I've talked about who we are, we're the peak body. So when you get fully fledged and you're a professional out there, we have a lot of physios that are professional members. Actually, the highest percentage of our professional members are physios, right? Which is probably no surprise. So what do you get from being a member? It costs a couple $100 a year. I think it's $245. Not for you now. As a student rate, I think there's a $50 student rate to become a student professional member. What that gets you, you get to go to 4 professional events a year. Last year we ran something around the ageing athlete when the Masters Games were. We ran something for the female footballer when the Women's World Cup was on. We ran a golf education event when Live Golf was on here in Adelaide. So we try and theme what's going on in the year, and then we run some education around that. So you get to actually network. The biggest thing that people say to us about why they want to be a member is A, they get PD, they get professional development outside of what you do in this space. They get ongoing professional development, which you need, obviously. And then also it's the networking. So when you're out as a clinician working, you have met, doctor whoever or the orthopaedic surgeon, whoever, and you develop relationships where you can phone them, get on the phone, actually, I've got this tricky patient, I don't know what's going on. That's why people are members of SASMA. Sports medicine, I know, is not for everyone because you might go into other specific areas, but a lot of you do MSK, which clearly is connected with sports injury management. Claire, what are you thinking I might have missed? I've gone pretty quick because I can't remember how much time I've got.
Well, we've got good time we've got flexible time for around here, so you can have longer if you would like.
Right. No,
but I think the things that you talked about previously that I'd really enjoyed hearing from you in other years is around what they should look out for if they're looking for sports trainer work. From my perspective, I get sent lots of jobs that everyone thinks, physio students, they'll volunteer for me. And volunteering is great, but sometimes, there's lots of opportunities, and you'll see when I get my course pages up, I do lots of, this club's looking for a sports trainer, and I feel like if I was you, I would feel a bit overwhelmed about who am I choosing or how can I go about navigating that, contacting the club, asking for remuneration, or if I've got my trainer degree, how do I navigate that as a potential part-time job?
Yeah, perfect.
Working with clubs at this stage.
I'm going to flip over here because you're probably sick of seeing me, just so these guys can have a look over here. But so to be a trainer, so there's no doubt there are not enough sports trainers. Okay, so there's not enough people that are sports trainers out there. So we get inundated. Hey, on our website, like you would have on your student pages, however you promote it, there's all these clubs that say, hey, we want a trainer. What we are noticing is that some clubs maybe don't always treat trainers well, or they don't recompense them, or they don't pay for their insurance, or they don't pay for their course. So you're well within your right to say, actually, I've been on, so just remind me, so there are placements, right, that they go? No? Was it in the hospital setting more or varied?
We have placements in hospitals. We do have ones in private practice, but they don't necessarily, we do have some sports experiences with physios that fit in placement.
Yeah.
I guess, therefore, if you're doing that within a placement, you're covered by, this is awful, this university insurance. But I was thinking more it's around if you're seeking that part-time work.
Yeah, so of course, you're very appealing to a sporting club, right? Because you've got all these knowledge, you've got all these great skills, and they're wanting someone on the sideline to help. So that might mean 2 trainings a week, Tuesday, Thursday. It might be in a Saturday game, being with the first team or whatever it might be. But I think you should be saying, hey, I'm happy to, do this, and, but you need to pay me. So we pay our trainers, if they are in any event that we run, we pay them $35 an hour is what we pay our trainers that are to go out and about. Some clubs might say, actually, we give you an honorarium of $4,000 for the year, or we will, some of them say, hey, what about we give you, food vouchers to the club rooms every Thursday night, you get a meal, whatever. I think you should stick to your guns and say, actually, I'm giving you a service. this is what we're now saying. You pay your coach, often you pay your players, you pay the boundary umpire. I'm talking mainly football here. It's Australian rules football are the people that mainly have sports trainers. But out in the regions and the country, it's often the netball, football stick together and you do a lot of the taping of the ankles or whatever it might be for both sports. Or same for rugby union, rugby league here in soccer. They do have trainers, but AFL, Australian Football League, is where mainly trainers are. They pay everyone else and you're no different. So we're advocating really strongly to say, actually, you need to pay these people, right? They're no different to anyone else that you've got in your club. What, are you saying the boundary umpire is more important than someone that's looking after the health and safety of your players? So they need to pay you. And I think you're well within your rights to say, actually, so what is the pay structure for this? I know some people get paid $25 an hour or $30 an hour. We probably pay at the higher end of a trainer and being $35. But I think definitely, 25 and above, I think is definitely the way to go, and, probably beats picking up glasses or wiping tables, maybe.
Yeah. I guess I'm just thinking the other things they might look out for, I guess is what it's saying is that, you're lucky because there is a shortage of sports trainers. So it does give you some chance to professionally go into those goals and go, well, I'm just wondering, look, I really like the idea of your club. You've got a great community feel. I don't have my trainer things yet. Can I just check, would you, if I can take this role on, would you support me to be able to, pay for me to do the level 1 training course, and can I check what are the insurance arrangements and those sorts of things. So I think it's just letting you know that it's okay to ask those questions. But, you will get grassroots clubs or ones that maybe you've played for, and again, you're happy to kind of get some experience. And the other things you might look for is that if they do have access to a physio as well, so is the value proposition for you that, are you going to be the only trainer there? Is there a more senior trainer? Are there other people that you're keen to connect with? Like, is there another physio there? So actually you're budding alongside somebody, a different professional, or do they have other team members that you want to get to know, and maybe that's part of what's great for you. And the other thing that I'd be really interested in your opinion on is I imagine what's the challenge is that creep of role, because they go, oh, great, you're physio, can't you doing that? So you may find yourself in some tricky situations of working out, hang on, are they asking me to do something more than what I'm qualified for as a sports trainer? Your knowledge is really great for that role, but I imagine you can find some situations where you find that hard to reconcile on the side of the field and whatnot.
Totally. I think that's a really good point. And yes, it's not all about the money in these scenarios. I think you can learn a great deal, and certainly when you finish being a sports trainer, you can tape everything and you're pretty amazing by the end of it, because you're sort of forced to do it on the ground and you get really great hands-on experience. I think in relation to mentoring or working with other physios or even other trainers that have been in the club for 10 or 20 years, you can learn loads from these people. I think it's really worthwhile. I definitely think we have a code of conduct, right, for the sports trainers, and we often have people that are allied health, they might have other qualifications. When you're there employed or acting as a trainer, you have to only be a trainer. We often have people that are physios that work on Masters games. They said, oh God, it was so tempting to go and do this, but I know I've got to stick within the sports trainer, role of the sports trainer, because you're not there. In relation to insurance, I think it's a great question, and it's a grey area which I don't want you to fall into. There are things like sports trainer insurance, which I know costs $150 a year if you want to do that, which a club, if you want to do a trainer, the club could pay for that. The other thing that we ask trainers to do is to check with their club. What insurance policy do you have? Because what we know from talking with our own insurer about the events that we support and have medical support on the ground is we know if they write in there, specifically in the area, we deliver sports injury management service through our sports trainers. If they actually write that in there, then you're covered. You don't want to go and do something inadvertently and then there's a problem and someone comes back at you. Of course, they always go to the club, then the association, then the peak body. So, but I think having some insurance, checking that the club, that you're covered under the club, and you can also say, actually, can you send it to me? You are within your rights if you want to do that. I know I'm sounding really officious, but I know some people have got a bit caught out. Or you could say, actually, would you mind paying for my insurance? It costs $150 a year and I'm committing to you for a year or whatever it might be.
I think that's the value of that membership and connecting with Danielle and the SASMA and that community is that that there's advice around that type of thing, so you don't have to feel alone in trying to navigate some of that. But I just thought those are some of the common other questions we've heard, but I don't know if anyone else has got any other things from the room or Mitch experience as well around questions around that type of work and how you might if it's of interest to you.
Does anyone have any questions? So you know what we do. We're the Peak Body. We're a not-for-profit. There's around 7 staff, and we run around 70 events a year, right? So 70 sports units. Some of them are for professional members, and some of them are for sports trainers. We run a major conference. This year we actually have combined our professional member conference with our sports trainers for the first time to see how we go. Because we think having that mix of professional members and sports trainers, that helps with the communication. And you know, when you're out and about and you're a physio in the real world, having referral pathways, connecting with other professional members is key, I think, for you to have that support and to be a great clinician.
Yeah. Was there a question?
Yeah.
So you guys offer roles through yourselves, like the Masters Games
Yeah.
and stuff like that. Would there be a way to
Yeah.
get involved with that?
Yep. So we, so for example, the Masters Games is our bigger employer of trainers, and often we had like, did any of you girls that did it last year, when of you did the Masters Games? Anyone here worked with us with the Masters Games? Yep. How did you find it?
Yeah, it was good.
Yeah.
Older people, like different experiences of sports trainers and that.
Yeah. So literally, we go and you have a contract that you work with SASMA, and you would say, hey, I've done my qualification, we check that, you go into the hat. Of course, we want experienced people, but we are trying to get a younger group of people through. You've got people that are ready to retire, or they've had enough of being a sports trainer, or whatever it might be. So we're wanting a new batch of people to come through and support, so we can have an ongoing impact of supporting sport on the ground. That's what we're about. We want people to be physically active like you do. So how do we do that? We've got to have some safety measures on the ground. We actually have just pitched a grant to the Office of Sport and Racing through Minister Hilliard, who's the Minister for Sport, and it's around a club safety tick. So what we're trying to do, we haven't got the grant yet, I'm going to know hopefully by the end of the month, we're trying to get in place that clubs, if they have a tick, a bit like a food tick, if it's, it's got a tick, it's good for you, supposedly, but if you have a tick in the club, you've got a defib, you've got a stretcher, you've got a first aid kit, you've got qualified people, as in accredited trainers, all first aiders on the ground. You've got a concussion policy. You've got a relationship with the local doctor, the local physio, that you can get support. So we're really hoping we get this grant, because we know there are gaps out there. It's no good having all the knowledge, but no one in the club knows how to recognise a concussion, refer them on, right? Recognise, remove, refer, if in doubt, sit them out, all of that type of stuff. So we're looking to have that grant, and that will only support you guys or anyone else that's working in the club environment. So yes, I've left some flyers here. If you do I'd really encourage the Allied Health Sports Trainer course, if you're interested, is in April. I think that is a really good one to go to, because there's all Allied Health people in the room. So I think that's great. I think if you're interested in the conference, up to you if you want to do it. And then if you're from Adelaide or living in Adelaide and you want to be involved, be a professional member, become a student member. I think there's even this deal that we've got going with the conference that you get a student membership or something or other. And then you will see our communication that comes out, be invited to our other professional events, mixed with other professionals. Right, is that it? Have you had enough of me? Got a question?
Is the level 2 running in April as well, or is that a different day?
No, that's not running. It is running, but that's not part of the Allied Health Level 1 Sports Trainer course. But we do have I think we run 3 to 4 Level 2 a year. So for your information, you have to be a trainer for at least 1 year before you can become a Level 2 trainer. Yeah, because we want you to have that on-the-ground experience to be able to do that role, yeah? So, so Level 1, you start at Level 1 and then you go to Level 2 if you choose to. And we even have a starter course called Sideline Help, and that is an hour and a half, and we deliver that to parents and to clubs and juniors, and it's, your basic what to do if you have an injury. And if you're a parent, you don't really have any medical background, because as you know, a lot of sports now say, hey, parent, can you put on the medical vest? So they're presuming that someone has got some medical, but often what we know is that people don't have anything and they're putting on the medical vest and they've got no idea what's going on. So we're trying to do the education on the ground, and you guys are in a great position that you're able to volunteer, get paid, learn more in your role, and if you wanted to become a trainer or a professional member with us. So you've got our details there, you've got my details up there as well. Give us a call if I've gone too fast, which I do tend to do, or you want any clarity, or if you want to book in and do something, just let us know. Are there any other questions?
If you do come up with other questions, you can always send them through to me or through to
Yeah.
Jared on our team that's really connected as well.
Yep.
So you've got, inside people there.
You do. You've got Jared Strawbridge and Matt Pryor. These
Matt
part
Pryor, yeah, I was
are
gonna say Matt.
both part of our council, so the board that I report to. So you're pretty covered at Flinders with SASMA. You've got some good people involved, so hopefully they can also support what we're talking about.
And Matt Pryor, huge amount of experience working in sport with teams, Australian, like Paralympic teams and things like that. As an athlete, we've got Tori, who does, I can't remember the title of her world record, but she's run a marathon on every continent in some Masters something or other, so,
Actually, and do you have her physios at Bailey Kendall?
Not here, no, that's not. I don't think so. Oh, unless it was a graduate of ours, but
yeah, maybe she's.
Oh, she's.
Yeah, correct. So she's actually working because she's a sassy athlete. She's a volleyballer, and she is doing some admin work for us, just picking up 6 hours a week or something. And she's just going away for a bit. But yeah, she was saying that now. So what I didn't say, which is a really big point, is if you are interested in going into the elite sport pathway, this is your pathway in. So the likes of Matt will be able to say that. I've got a guy, there's a guy called Karthik Badranath. He's a sports physician. He started as a physio. This guy's a smart dude. He started as a physio, then he became a doctor, and then he became a sports physician. And he actually got into it because he chatted with my counterpart when someone was doing my role, 9 years ago, and said, hey, how do I get involved in this? What do I do to get into sports? I'm interested in elite sports. Now he's part of the Crows. He goes away with Olympic stuff. He does international cricket. So if you're interested in that space, you have to get hands-on experience. And the only way to get hands-on experience, from my perspective, is to be involved with a club, clearly do well here, and then do a trainer role, because it just adds value to you, no doubt. Anyway, I'll leave it there.
Thank you very much. We give Nadia a round of applause. Thank you. And I'm going to get Mitch up. We've heard about Mitch's organising events. He's done games. He does all sorts. It's a real pleasure to have Mitch part of our program, and he will tell you from the student's perspective a few things just now. I've got a session this afternoon in smaller groups.
Quick toilet break or something? Or you're running out of time?
Oh, we've got APA in 10 minutes if they
I'll
time, which we Are we out to power through? We've got Mitch and then Casey from the APA coming, and then it's lunch. And Mitch is the most interesting part of the morning because it's actually the lived experience of what you're going through.
Great. Right. Hey guys, welcome to you all and congrats on securing a place in the Masters program for 2024. You've got a exciting year ahead. I definitely would say that last year was the most exciting study year of my life, so I look forward to it. And year two is just as good so far. I'm just here to talk about the Flinders University Physio Student Association, which I'm going to call FUPSA from now on because it's a mouthful. But we're basically the peak representative body for Flinders Physio students, both in the Masters program and the health science part of that as well. Basically, we offer a number of educational and social events throughout the year for our members and physios who are the physio students, you guys. These are events outside of your study, so additional things that we want you to get involved in. And basically we get some funding from the Flinders Uni Student Association, which is the overarching body that provides some funding each year so we can subsidise some events for you guys. Just firstly, can I get a hands up? Who's come through the health science pathway? Nice, okay. A different degree to get here, or interstate degree, or, yep. And international? Great, a nice mix. Who's heard of FUPSA before? FUPSA? Yeah, a lot of us, great. that's good. All right, I'm going to start by... That didn't work very well. Can I edit it? You won't be able to scan it. Yeah, great. So I'm just going to start by putting up a couple of QR codes. So the first one on the... Start with the one on the right, but yeah, that's great.
Is that okay?
Yeah. All right, so the one on the left is to sign up as a member. So you just fill out a quick form to sign up that way. That's just the easiest way for us to contact you guys in regards to any events or things that we have coming up, which I'm going to go through in a sec. The one on the right is another really good way to kind of see what we've got on, is just our Facebook page. You'll be able to see, yeah, like I said, any events coming up and that sort of thing. I'm going to put this back up in a sec, but let me talk about some events quickly. All right, so this is a bit of an outline of the first half of the year, what we've got in store. Starting at the top, we are releasing some merch, hopefully end of the week. I was hoping it would be done today, but not quite. So that's one to keep your eyes on our Facebook page for. March 6th will be the FUPSA AGM, so we're looking for you guys to join our committee and to help run some of these events. So if anyone is interested in that, I'm going to put the QR code up for that as well in just a sec. But we'd just love you to fill out an expression of interest form and then come to our AGM to get on board. There's roles for everyone. Late March, we actually just got the confirmation of the date a minute ago. Did I write it down? The 18th of March for that CPR course will be 9 a.m. to 11 a.m. So obviously you need your CPR for placement. So that's, they're going to come here to uni to run that for you guys. So we will subsidise that course for you.
Yep. And you did contact me about checking around your timetable, but if for some reason I have got it disastrously wrong, because I think some of you got classes that start at 11, please let us know ASAP. But we have tried to do the cross-check to make it like it's around your prac classes, so you should be able to come in and do it. Thank you. I think we're good.
Yeah. 18th of March, yeah. Hopefully that was the week that was just lectures to do online. We'll find out. From there, as you just heard, we're running a basic sports taping night. SASMA are going to come here and run that as well.
They're fine.
Yeah, beautiful. Okay, sweet. Okay, so that'll come out shortly. That'll be on our socials. So get involved in that one. Like I said, SASMA and the sports taping night, that'll be held here on a Monday night or a weeknight after uni. So that'll be an evening event. A good chance to get an introduction into taping. You do learn some towards the back end of your first year at uni as well, but a good chance to get on the front foot with that if you've not had any sports taping training experience and you'd like some. June 3rd's locked in. We're doing we've got rock tape coming here to run kinesio tape night, which is slightly different to your standard sports taping, which a lot of physios use. So they're running that. So hopefully you get something out of that one. And again, that'll be on Facebook page. And then June 29th, we've got our annual physio ball. Has anyone been to a physio ball yet? Couple? Nice, great. So, tickets aren't quite out for this one yet, but it's a really good night for the two cohorts, the first and second years. We get together, we dress up, we have a few beverages potentially and have a good night. So
I just need you ready for placement on Monday. Like, that's fine. Your weekend is your time.
Yeah, you've got Sunday to recover. So
that's right.
It's on a Saturday night. So that's kind of the outline for the first part of our year. Second half of the year quietens down a fair bit just because you guys have got placement. We've got placement as well. To be honest, most of this is directed at you first years because a lot of us are on placement at the moment. So it does quieten down from there and we focus a bit more on the health science guys and the intro to the master's course. So anyways, bit of an outline of the year. This year's to sign or nominate for a role on the AGM if you're interested. That'll be on our socials as well. But like I said, we'd love people to join. We've got plenty of roles. So there's president role, vice president, treasurer, secretary. and then we have some executive members. I think I've missed any there, but it's really doesn't take a whole lot of your time. You might have a couple hours a week or even less. It's mostly just involving some messaging in the group chat and then some time spent at events to help out there. So yeah, I'd love you to get involved if anyone's interested. Yeah, then I've just got that back again, which is not good. So I'll put that one back up if anyone didn't get that the first time. But like I said, these are the best two channels to, well, signing up is a great start, and then our Facebook page is a great channel just to keep an eye on what's coming up. So yeah, go for that. That was really all for me. Does anyone have any questions about the association or anything I've just talked about? Great. Does anyone have any questions about, do we have time for, any questions about like placement or anything about study from a student perspective? I know a lot of it's been probably answered, but
The other thing is this afternoon when we go back upstairs, I think you're able to stay around, and we've got about 4 or 5 other final years coming in as well, so you can actually just ask your questions quietly in there if you would like to as well. So we have built in that opportunity where you can do some of that more direct information sharing around that if you don't want to ask now, but you're welcome to ask anything now if you'd like. Yeah?
What's the mentoring program for physio?
This afternoon. Yeah. Leave that one to me, that's fine. So, so when you come through your groups and you see me this afternoon, we'll go through it and get you guys started. So.
It's starting to feel very confusing, isn't it? It's like I feel like the morning starting, we're like, oh, this is my course, this is what's happening. Oh, I can join as a student rep, which is the one that connects with me. I can join FUPSA and go through Mitch. I can be a mentor and a mentee and be mentored via Alex's program. We've got social events that we run, that you run. There's SASMA. We're about to hear from Casey from the APA. So I know it can feel really overwhelming, but the silver lining is there's heaps of choice. There's different ways to get involved and think about what suits you and what you might like to do. So, yeah.
Cool. Great. Thanks, guys.
All right, have a stretch, guys. Yeah.
That's good.
Sorry?
Do you want me to go?
It's 2 o'clock that we're back up there, so it is a bit of a break. And I've got 2 things at the high coming in. And Josh had said as well, I was going to think to S or 10 to kind of do, and fairly well just have it as a, we'll rotate them through and you can run informal Q&A chat.
They just around that, but
So for 2 o'clock up here,
if there's none left, don't worry. Claire will have some.
I reckon we can do that till, I reckon we're done with 3:30 because it's not as many people, so if we do 3 groups, we can do half an hour, and half an hour. We'll take them through there would be great. Unless when I finish with Casey, we have to have coffees at 1. I think she'll be out, she's like, if you want to grab it, good.
Oh, right.
And no friends. But I do have a coffee for you upstairs. Yeah, 2 o'clock,
Tracy just messaged me, they've put the dividers across W406.
Oh, wow. What's that for?
So you might, I'm hoping you can use the door.
Oh, that's okay.
For new prac exams tomorrow.
Oh.
I know.
Oh, that's all right. The prac room might be tidy.
Like, no, Tracy's
Oh,
done
she's
it.
done it.
Yeah, that was the job I delegated.
She's doing that.
I'm going to duck upstairs.
All right, the last session of our morning, we have Casey Garnett, who's the South Australian branch manager of the Australian Physiotherapy Association. Casey and I have known each other since she started working at the APA, 12 years. Yeah. I remember, I was on so before Casey was branch manager, I was on the panel interviewing the branch manager before her, because I was involved in, Casey would tell you everything wonderful about the APA, but nothing like a personal little story. So I joined when I was a student, and I joined the APA student committee. I think I took up treasurer. Anyway, I think that's the role I took on the student committee. So again, did all that, some supporting running events through the APA as a student, and had always been a member through. And then I'd actually got I got a tap on the shoulder from one of my past lecturers who said, I think you should come on branch council. This is after I'd been working for 12 months, I reckon. And I went, okay, it's fine. The form's so easy. I'll send it to you. We'll sign it and be like, and it's like, okay, that's great. And I get to my first branch council meeting, and they're like, okay, so we need to like president, we need to do some vice presidents. Claire, I think you should nominate for vice president, but it's totally fine. We'll find a co-vice president for you, and they will work with you and do that before you do it.
Was that Di Wilson?
That was Di Wilson. So I said yes, and so then 2 years out, I was finding myself on branch council as the state branch vice president, and then a few years later, president. So I have done time on branch council, and then in the meantime, I've jumped to I'm in the cardio group. So I've been the cardio group for lots of years. So for lots of years, I was the only member of cardio group, but we've got a committee now. We've got 5 members, which is great. So I tend to sort of more help the committee through that. But through that, I'd stepped up and then been the South Australian cardio rep on the national groups and things like that. So I'm still part of the educators group in the APA and bits and bobs, and you never know. You never let me go. No, and I probably won't go, and I'll probably find something else that interests me shortly. So I've had different ways of going, but for me, being engaged has been good because I get to meet people and understand those broader areas of practice. So that's just how I've connected with the APA around a range of things. But I'll let Casey give you more of about the organisation and how you can be involved.
Well, I don't even think I need to say too much, because Claire is just the example of how far the APA can take you. But I'm here to actually tell you who we are as an association, because I just heard 5 minutes before you were being bombarded with associations and networks, but who we are is your main one. But before I sort of get into that, I actually wanted to just say hello and say congratulations. I have actually just come from doing this same speech at the University of South Australia. There was 100 plus in there as well, first year students, and they're probably looking at me just the way you are, so much information is going in, but just know that this is the best profession in the world. I could be a little biased. I'm not a physio myself. I actually have a marketing background, but I have been with the APA for 12 years, which shows just how much I love physiotherapy, physiotherapists, and what you guys continue to do, and how far you're taking physiotherapy. It can just take you so far. So pat yourselves on the back. It's really hard to get into. You're the best of the best, and I cannot wait to see how far you go. I'd like to acknowledge the traditional owners of the land that I stand on today. And like I said, my name is Casey Garnett. I'm the manager for the South Australian branch and the Northern Territory branch. I have started off in membership, I've done professional development, and now I actually also got the tap on the shoulder to be the manager when the fabulous one before decided to retire. How dare she? She was with the APA for 14 years. So again, it just shows what a wonderful association that you get to be a part of. But what is a professional association? Just to really be clear, we are external from the university. We are your national peak body representing only physiotherapists in Australia. So think of it sort of like a football club. It's your tribe. You want to be a member of your association because right from the time that you start through to when you graduate, been out for 10 years, even when you retire, you always stay a member of your association because there's nobody else working behind the scenes for you except for the APA. But what do we do? I actually did write down some notes for this because I think it's important what we do. So we have been an association for over 100 years. When I say we work in advanced physio, it means a couple of things. We support cutting-edge research. We're at the government table working on healthcare policy. We educate the public on what physio does. When I started at the APA, I just assumed every single person of the public knew what a physiotherapist was and what they do. They don't. It's not just sport, it's not just musculoskeletal. We cover 20 different interest areas, the whole body. It's incredible what we can do as a physiotherapist. And you really should know that right now. So where you start now, where you finish, where you're going to go on your journey, physiotherapy can take you with elite sporting companies, the public sector, rural, private practice. I actually met a student who I met 11 years ago. They've just recently been to LA and they were a consultant on the Grey's Anatomy set. So, and I'm not joking, this is a real thing. I was floored. So just know that if you ever get frustrated in your profession, think, oh my God, I've gone as far as I can, I'm bored, I'm just burnt out, pivot. Just like, I don't know if you've seen Friends, pivot. Oh yeah, pivot. And change where you want to go. And being a part of the association allows you to do that. Like I said at the start, the more members we have, the more voice we have, the more change we can make. When I started 10 years ago, we were 26,000 members. We are now up to 36,000 members across Australia. So, like I said, if you think just as a first-year student now, you can't do much, think again. We think all of you are just as important as someone who's been out for 10 years. Best of all, it's free. So if you've got your laptops right now, I want you to get onto the APA website. It takes less than a minute to join up. I've also brought here today old school student membership forms. And I'm going to leave this here as well. It's a little code. But in your own time, go online, sign up for membership because you actually get for free as a student, the whole time you're a student, what Claire does, and she pays a little bit of money for membership. But it's the best way to sort of get a feel for what we do, and also you get insurance included in this membership as a student. So if you want to start doing things like taping and yoga and being trainers, for example, we sort of give you that too. But I don't want to get too much into that. Just know that it's free. I know you're all very smart because you got into this course, so sign up now. We have a student page. It's brand new this year, so it's a little clunky, but you can go to the APA website, type in student, and this will come up. She's going to kill me for putting it on the page, but the girl jumping for joy, her name is Victoria Kawani. Is Victoria. She is a Flinders University graduate. She's been out for 2 years, but from her engagement as a student, she joined the APA Student Committee. She then won the very prestigious Board of Directors Student Prize. She got to go, for example, to like our advisory council, so many things. She got a job working for Carlin. She has travelled all over the world, and now she's decided to move to Darwin, and I connected her with the Royal Darwin Hospital. She did the rest, and she's moving up there in March, much to my...
She did a placement in Darwin, so it
there you
started
go.
here. And that was a national prize across all the students, World Prize. So, yeah. She's going to Darwin.
I know. Oh, God, I just
I'll tell
love it.
Tracy.
So she was also on Brunch Council as well, because I was like, don't go. Still don't go, but at least I look after the Northern Territory. So I've become very familiar with you. I love my working with the students. It really brings me a lot of joy in my job, and just seeing where you start to where you can go. She's a powerhouse. I can't wait to see what she does next. How can we help you at university? We get you out of university. So we want to connect you with the University of Adelaide, the University of SA, and just also all the other already established members. We are, though, located in the city. We are at Kent Town, which is just near the Maid and Magpie Hotel. It took me under 30 minutes to get here today, so don't be afraid to branch out, hop in your car after uni and come into the branch and start attending external professional development. We put on free webinars and lectures. We offer advice. We help you through uni with a little survival kit. You don't need that. You've got the tools already here. Of course, it's networking. We offer academic prizes. Flinders have one, and it is a full APA membership for when you graduate, with money towards professional development as well. Or it could also be cash. I need to have a look at that, but it's worth going for. We also offer discounts and rewards. So when you sign up for free, you also get access to member benefits, which is on our website. We know that you might not have as much money while you're going through uni because it's so packed. So we offer discount on sneakers, electrical goods, travel, holidays, because we know you always find money to travel, as you should. As physiotherapy have evolved, like I said, I didn't realise how much physiotherapy covers. We now have over 20 national groups. So they're the interest groups. As students, you can go to any lecture that these committees, and we have a committee for each of them here in SA, put on for free. It's a great way to start thinking about where you might want to start off your career. They're always looking for committee members, even as students. And also, if you're sort of like wanting to start connecting with someone who can help you in sport, with an elite sporting group, we can connect you with someone in the sports group. But just think about that. How to get involved? Everyone wants you to get involved. I've just heard that. But at the APA, we do have a student committee. We are looking for a rep, even just from Flinders. I have one in your class above you. Her name is Kimberly Hanson. She might even be coming to speak to you today. But we're always looking for other reps as well, because like I said, we do want to listen. We want to hear what you want from us. Do you want us to put on taping events for you? Do you want us to put on practical paediatric events for you? Or do you just hear something from your placement that worries you and you want to talk about it? That's who we are as your association. And like I said, we're going to look after you right through to when you retire, and it's just such a wonderful profession to be in. So, is there any questions? I know I've gone over, I think, quite a bit, but it's sort of hard to try and get the...
I just know the retirees group looks fun. I'm a long way away.
We always do things with drinks and food.
I know, it's great.
That's right. Yeah. But Claire is a member of the APA, has been since she was a student. Every single tutor here is a member of the APA, and a lot of them are on committees as well. So, yeah.
I have a question. I'd love to hear also about the getting ready for jobs stuff that you do. Like I know pub chat and things like that. I'd love to see as many of our Flinders students engage with that. Can you, tell us about what are some, there's all the PD events, but those sorts of events and how they connect in with those things that help them connect with employers and
afterwards,
jobs and things.
Yeah, so we put on a large networking event. It's the last Wednesday in August. It's called Pub Chat, where we invite all final year students, but with Flinders you get to come because you're sort of the final year in your year. You've got two.
Next year?
Next year.
But still, keep an eye out for,
Yeah. But we have that big event, so we invite any one of our members across every single sector who is wanting to employ. We put on a panel so they can tell you about what you can expect working in that sector, and then we give you time to network with them. Every single year without fail, students have gotten a job just by going to that networking session. It's like any other industry. It's sometimes not what you know, it's who you know. And already starting now, getting out, connecting, making your face known. When you're on placement, do it the best you absolutely can, with a smile, with a great attitude. They're going to remember you when you come time for an interview. But we do put on other events such as CV writing, tips on the interviewing process and some other job-ready events.
I just said there'll be more things that sit for you to access next year, but I guess I just wanted to, because I just know that there's such great events, and just to flag that there's things that we do here at the uni and through Career Hub and things like that for that job writing. We also do run some panels and activities here, but knowing that the APA does that event, we'd really try and not overlap but link in together around that to sort of do that. So that's how closely we partner with to see you be successful and to build those connections. And so we'll leverage what we've got here at the university, but also connect you in, and those events are fantastic. So while they're next year events, I know people start getting keen at that stuff now. So keep an eye out for it so you know what to expect around building those other skills, as well as your clinical knowledge skills is great. Yeah, you're there to help with all that too.
Yeah, we have a wonderful relationship with Flinders, and we were here right when the program started 11 years ago now, I think it could be,
Here's
this
a cohort
program.
13.
13!
I know.
Lucky 13. Well, there you go. So, oh gosh, it makes me feel a bit old. So don't feel as though you're never disconnected because you're not in the city like the other two. If anything, we sort of think you're a little bit more special because you're smaller, you're far more engaged, and you allow me to come whenever I want to. So if you need me to come back to talk about anything, if you want us to put on anything for you, send us those ideas that way. Or like I said, get involved and join the student committee.
Thank you. Any other final questions to see us out to break? I'm going to put that poster up on my door. That's probably the easiest way for you to be able to scan it once we go upstairs.
Oh, did I say, I've got these TheraBands to give out as gifts. Nice. So I'll keep them in my APA bag.
Yeah, they're heading out to a lunch break now, and this is where the afternoon gets... Actually, I just might swap microphones because this one's awful. This is where the afternoon gets tricky, only as in, so we're back on from 2 o'clock, so you've got a good hour and 10 minutes for a lunch break and to look at what they've got down there. I gave you your coloured tickets. That's because we don't want to be overcrowded in all the rooms. So essentially, if you've got a pink ticket at 2 o'clock, can you come up to W406? So that's W stands for West Wing. That's the one where you've either got to take the lift up or the end stairs. If you don't know where you're going, ask somebody to help direct you, and we'll be standing up around there. You'll be with me. We'll be going through prac room orientation. You can do a bit more of a Q&A with me about the rest of the program. I'll also get you to return to me then those consent forms up the back about practical skills and things as well. And we'll also do your quick photo for the photo roll if you've given that. If you haven't got your form, you can bring it upstairs and I'll bring the rest of them there. But if for some reason you do need to go and not hanging around, give it to me now. If you've got green, you're in S407A, which stands for the South Building. Alex will be in there about the mentoring program, her student engagement support role, so we'll go through that. If you've got orange, can you go to S410? You will catch up with Mitch, Tegan, Xanthi, Kai, and maybe, I think Josh may be coming in. So that's your chance, without me watching or looking or having to have it in front of everyone, you can ask the final years how they find things, and I've asked them also to take anyone that wants a bit of a tour around campus to know, so you can see where's health to go, where they like to hang out. They're going to be half an hour sessions each, and we'll rotate you through. So if you just get to your first room at 2 o'clock, then we'll spread you around, and we'll get out at 3:30, hopefully, that means, which will be nice. If you're not sure where to go, just lob into a room, otherwise. All right, I need to let you go. Thank you, everyone.
You want to swap? Casey, can we swap the mic? Could we swap the mic? Swap the mic.
No, because they want to give it to Pierre. So you keep that one on you.
Oh, okay.
All right, guys. If I can get your attention, So then Nathalie will present today. Thank you so much for coming. And then please take notes if you need to. And then at the end of the session, I'll pass around the microphone for you if you have any questions about the presentation. Thank you.
Okay, hi guys. Sorry, can you? Okay. Yeah, today's article will be, the title is The Benefits of Vegetarian Diets for Reducing Blood Pressure in Taiwan. So basically it's a study done in Taiwan, and it's a historically prospective cohort study. Wait, sorry. Oh, yeah. So basically the outlines will be talking about the background of the study, methods, results, discussion, the strengths and limitations, and the implications for practice and future research, and also conclusions. Yeah, so this is the author information, basically just a citation for this article. Because the article is also stated that it's a cohort study, so basically I've chosen level 3-2, which basically a cohort study is just a longitudinal study that follows participants over a period of time, which is often many years. And so here's some background information on what is high blood pressure and hypertension. So it's basically classified as blood pressure greater than 140/90 yeah. So the prevalence of hypertension in the world is about 1.28 billion adults aged from 30 to 79. Specifically for this study and through some research, Taiwan has about 25% of the adult population having this high blood pressure condition, and for Australia it's about 1 in 3 adults. Yeah, so some of the risk factors for high blood pressure is actually older age, genetics, being overweight, physically inactive, having a high salt diet, and also drinking too much alcohol. So basically the problem is there's sufficient literature that says that well-controlled blood pressure levels are associated with greater probability of survival to age 85 years and increased long life without extra comorbidities. So the prevalence of hypertension will actually increase substantially with age, and also because we're having an aging population, and it's also growing rapidly worldwide. So there's actually some reason to why we are doing this study, because of the significant attention it will receive. So basically, for this study, we're going to talk more about vegetarian diets, and so basically this study they did cover. They were testing subjects who were on different types of vegetarian diets, like vegan, lacto-ovo, and also partial vegetarian. So some of the definitions from this study are already here. So for partial vegetarian, it's a bit interesting because it includes pesca vegetarians, which is basically vegetarians who eat fish. And so basically for the non-vegetarians, they just basically are omnivores, no dietary restrictions, which is also like the control group for this study. Yeah, so the aim is basically to compare the difference in mean blood pressure of participants who are already on long-term vegetarian diets like vegan, lacto-ovo, and partial vegetarians with participants who are on long-term non-vegetarians, which are omnivores, as mentioned, and also to identify the impact of BMI and the relation to blood pressure changes with different dietary patterns. So basically this is like the secondary aim, but the first aim is the first statement. So basically from this table, it's kind of yes to everything. But for the feasible part, it's actually questionable because due to not many people willing to try changing their diets, so that's something to consider, which will be covered more later in the few slides. So for the study design, it's actually a database called MJ Health Database that it's a long-term tracking, large-scale, comprehensive population health database that basically covers the health clinics and databases from every single part of Taiwan. So basically it's nationwide. So many participants in the health database have multiple examination records because it's taken throughout time since 1994. And information collected via health questionnaires and the human body and biochemical test data are collected through the health examinations over time. And these data are always collected with no expiration date, so there's always records of it. Yep. So for research question, it's basically all yes. The target population is basically people in Taiwan, and the outcomes and various were clearly indicated in terms of BP management and intervention. It's not really intervention, but it's just an exposure because, which I'll explain further later in the next few slides. Yep. So for study population, they were looking at 504 subjects that participated in standard medical screening program run by MJ Health. And basically, they were participants who were 20 years and older. So it kind of defined the population there. And they were also followed up between 2006 and 2017. So the inclusion criteria is actually, initially when you read it, it's systolic blood pressure greater than 140 milligram hertz at the time of initial screening. And people who have a history of hypertension and also people who are taking hypertensive medications. So in the initial background, there was not much mention of exclusion criteria as well. So, so the methods include like a self-administered questionnaire, including a food frequency questionnaire, hands-on physical examination where medical histories and basically patient medical histories and blood pressure measurements will be taken, and patients were actually fasting before coming to the clinic. So, so when they came to the clinic fasting, in the fasted state, that they have been educated to take their usual medication before measurement of blood pressure, and they were instructed to empty their bladder and wait about 10 minutes before their systolic and diastolic blood pressure was measured using an Omron automated spigonanometer. And yeah, so basically 3 readings of the systolic and diastolic were taken 5 minutes apart. Yeah. And because of that, during the readings, they actually took out 4 participants who had a systolic BP of less than 80, so that leaves with a total of 500. So out of the 500, the average age was about 62.7 years old, and the demographics was about 64% women and 36% men. Yeah, so this is just a sample of the food frequency questionnaire that just to classify what type of vegetarian diets the subjects were actually following. So yeah, so selection bias, I would say that patients had their data taken from the database, and so there's actually potential bias on that. There's also no mentioning of blinding the names out before taking the patients from the database, if that is possible. But that would definitely help with the bias. Yeah, and also self-administered like food frequency questionnaire, and basically the questionnaires have, they can introduce like patient recall bias. So that's 2 areas that I've thought about. And for the inclusion criteria, I would say that there's yes and no because, there's inclusion criteria, but no, not really exclusion criteria in this whole study. And for 2.3, I just said maybe because like in the article, they mentioned a statement that there was a large range of educational attainment and subjects who lived in all major areas of Taiwan. So you can actually argue that it's not really, even though there's a statement there, it may not be really described because it's just a statement. It may not be described in detail. So, yeah, so next will be design and development. So they have taken reference from previous research about the DASH diet. So the DASH diet shows that it's actually superior to a more typical diet. So however, they also mentioned that the results of feeding studies of meat in the DASH diet has been inconsistent on blood pressure. So recent meta-analysis of trials on fiber consumption has shown small but significant effects mainly on the diastolic blood pressure. And overall, for hypertensive individuals, there's a more pronounced effect as a whole. So, and also most of the studies have been small, short-term feeding studies with mixed results, if you're talking about vegetarian diets, and most of them studied the lacto-ovo vegetarian diets rather than vegan diets. So there's a bit of a research gap. So for this current study, there's a cross-sectional comparison within a relatively large and diverse group, vegetarian and non-vegetarian habits, and were also generally long-term. And vegetarians also divide into vegans and non-vegans. Yeah, so it's quite broad. Yeah, so basically this is just, exposure is literally what I've just mentioned above. Is basically what the patients have just been exposed to as part of their normal diets for long term. Yeah, so it's just the same slide from just now. So information bias, I would say the first one is no, because it's also not an RCT, it's not a randomized controlled trial, and there's also no mention of blinding the entire study. For 5.1, it's not intervention study. And for 5.3, I put nil because there's no mention of any blinding the study as well. And yeah, so moving on to methods, it's, basically is what I've covered earlier, but in the food frequency questionnaire in the first point, they were just taking the food frequency questionnaire throughout the past year rather than the means of 6 dietary recalls, because this is a large-scale kind of study and you want to see patients' patterns across long term. So it's more valid to use the food frequency questionnaire when compared to the means of dietary recalls. And so the rest was just hands-on physical examinations by physicians. Medical histories were taken and by well-trained professional nurses, and basically the entire process was standardized to minimize intra and inter-observer variability in terms of the methods they're doing, where it's basically standardized where blood pressure was taken in a sitting position on the left arm and an average of 3 readings. So after that, the frequencies of intake were converted to daily equivalents using the table that I showed just now for the food frequency questionnaire. So from this area, they actually reported that half of the variables and about 10% of the missing data were filled by telephone in follow-up. So for the other variables, they just presumed that the data was missing at random, and but they just mentioned that it caused little bias, and this missing data rate is also small. So so basically that's the second point, is also like the second and third readings for the blood pressure was used for analysis. Unless there was a difference of more than 5, then they will just take the mean of all 3 readings instead. So this is the definitions of dietary patterns as attached by the study. So for validity and reliability, I would say for 7.1 it's maybe, because there's not really an endpoint where, because there's the argument of it's a one-time visit to gather blood pressure and all your other data. So there's not really I don't really think you'll count that as an endpoint. And for 7.6, other factors in the study were accounted for, like medications use, age, and exercise. They actually did collate all of the exercise frequencies from all the participants and group them to how intense the exercise was. And for medications, they actually hired a cardiologist to identify those hypertensive medications and label them accordingly. So for confounding factors, 6.3 I did say yes and unknown, because in the study, it says that the subjects are exposed to the whatever vegetarian diet and for at least for long term, like at least greater than 1 year. But the study does not really track over like a definite time period. It's so basically like even though patients were on this diet, but there's not really like a start. There's just an end kind of thing. So, and for 6.4, they did mention that compliance was measured via follow-up for blank data, and also food frequency questionnaire measures the amount of exposure. So these are the demographics of the subjects. So at the top header, 10% were vegan, 36% were lacto-ovo-vegetarian, 14% were partial vegetarian, and the remaining 40 was just non-vegetarian. Yep. So according to demographics, the average level of blood pressure level results was actually low for all the subjects. Systolic was 125.2 over 75.2, moderately high for those treated in systolic 133.3 and diastolic 76.3, and also lowest in untreated subjects, which is systolic 122.5 and diastolic 74.8. So the proportion of those that are taking medication known to reduce blood pressure is actually about 25.2%. So if you count in based on gender, it's 22.8% for women and 29.4% for men. So the study actually found no significant differences in blood pressure between 4 dietary groups among those taking antihypertensive medication. So the results I'm reading from this slide is actually not appearing in any of the tables, which is a bit strange. Yeah, but it's just reported, so yeah. So for statistical analysis, they did SPSS 22 version, and MANOVA test was performed to test null hypothesis of equal means between dietary groups, basically to test hypothesis of equal blood pressure means between dietary groups for continuous variables, while the chi-square test was used for categorical variables with 95% confidence interval. So linear and logistic regression modeling was also conducted by using statistical software, and where required hypotheses involved interactions were tested using these regression models. So these are the statistics. For 8.4, it was NA because there's no intent to treat, rather it's just exposure. And yeah. So looking at these tables, so basically this is a table that shows blood pressure in relation to dietary patterns with inclusion of antihypertensive medications adjusted for age and gender. So if you take a look at those areas that I've circled, it basically just means that those are statistically significant according to their various p-values that they have used for this study. So as you can see over here, actually there's statistically significant decrease in blood pressure as compared to the non-vegetarian diet, where we're comparing to a result of 0. So for lacto-ovo-vegetarian and vegan, we actually have shown actually significant decrease in blood pressure throughout all the readings. Yep. So adjusting so basically this is what I've mentioned just now. Systolic blood pressure was significantly lower in vegans and lacto-ovo-vegetarians, where it's about -6.8 and -9.1 as compared to the control group. And it was also similar for diastolic blood pressure, which is -6.9 and -5.8, which are all significant. So basically this is the same table, but it's just accounting for more, okay, I didn't type it in, sorry, but it's also adjusted for both for gender, age, and also BMI. So if you take a look at this, the second part over here, it shows that actually there's actually an increase in significantly increase in blood pressure when your BMI is above 30. And if you actually look at comparing this table and the previous table, it would show that BMI, actually the results once factored in for BMI actually shows a slight decrease in the effects of vegetarian diets on your blood pressure. So actually this difference compared to these readings are actually much lesser. Yeah, so discussion is, okay, so this entire page is taken from the study, and there was no table to really display these results. And even when they talk about things about like 2 to 4 subjects, I did like the math and it's 2 to 9, so I'm not too sure where they got their numbers from. So they were just, basically this discussion was just mentioning that the vegans had lowered systolic blood pressure by 7.12 when you're factoring BMI lesser than 25, and for lacto-ovo vegetarians, they were lower by 5.55, and partial vegetarians by 2.75. So these are for systolic, and for diastolic, vegans were lower by 5.1, lacto-ovo vegetarians were lower by 3.07, and partial vegetarians were lower by 0.52 milligrams. Yeah, so basically the strength and limitations of this study is that it covers different types of vegetarian diets, which is rare in the literature, and as also mentioned. And there's also a control group, which is your omnivores. There's also follow-up if there's missing and unclear data as mentioned, and clear inclusion factors. So there's also mention of reporting error and recalls in data in the food frequency questionnaire, and also the feasibility of various vegetarian diets. So limitations is calling it a cohort study is a stretch, because you're not really following patients on their blood pressure throughout time. It's just a one-off thing. But if their definition of a cohort study is just seeing how patients who are on their respective vegetarian diets over a long duration, then maybe that's why they call it a cohort study. And also it's called like historic prospective cohort study. So I guess they put like it's historic, I guess, if you're following from the past, right? And so data taken from database can have bias and errors in standardization. So because only for this particular data collection in that one visit was standardized, as mentioned, but data taken from databases can be different people who are doing the job. So there's no there may not be definite standardization in everything. So there may be an estimate of different results. So actually that will actually add to like error and all that. So implications for research is that so that it's possible that weight changes due to psychological reasons like insulin glucose metabolism, different comorbidities, and changes in the diet when you're changing from an omnivore diet to a vegetarian diet can result in weight loss over a longer period of time that may have already begun, and also skew the effects of the whole BP readings. So actually it may really start to affect blood pressure even before you want to measure like how long you be on this particular diet, because of the main reason is because of the BMI changes. So another thing is also like, that was not mentioned in this study was that dietary factors in the vegetarian diet may account for effects on BP levels is not well understood, because the food frequency questionnaire only mainly talked about meat products, but they didn't really talk about other like vegetables like frequency and whatnot. So it could be different. It could be due to potassium or calcium in like vegetables, but we don't really know because of this study. Yeah. So basically for the vegetarians also they're basically consuming higher fiber and potassium intakes as the result of increase in fruits, vegetables, and whole grain products. So current meta-analysis of randomized trials actually demonstrate small but significant effects of fiber. So maybe it may be a future research gap to fill in for maybe just basically having more research in the area of fiber and how vegetable and the different micronutrients actually affect blood pressure, which is a different type of scope, which we will be taking more of like biochemistry data, which is like a blood test to test for this micronutrient content in your blood. Okay, wait. So sorry. But anyways, yeah, so implications for practice. For people who do not wish to take medications, an option would be to try the vegetarian diets. However, not everyone may be open to completely changing even a small portion of their diets, because the jump from being an omnivore to even just being a partial vegetarian takes a lot of work. And it's one thing to try the diet, but to be consistent on the diet, that's a different issue altogether. And there's also limited studies for diets showing clinical significance currently. And there's also the one good thing about this study, it's very valuable because it's representative of the national population due to where the database has given the spawn, due to the database being like a national database. Yep. So bias limitations. It's not biased because the funding and the investigators' affiliations were clearly described, and they were two different parties. And yeah, there's also discussion of findings and conclusions being supported, and basically no conflict of interest. So for critical appraisal, I would say that it's generally positive. There were also, because like they did describe their intervention, their exposures, different factors like, even though it's very brief, like education, demographics, and statuses, and the study groups were also comparable between everything, and the research question was clearly stated, and the statistical analysis was also appropriate for the study design and the type of outcome indicators. So for conclusion, various vegetarian diets actually show significant evidence of blood pressure decrease when followed for at least 1 or more years, as mentioned in the study also. And it can be an option if people are suffering from hypertension and do not wish to take medications. And BMI decrease also shows a significant impact on blood pressure readings. So it's actually, when combined together with your diets, your BMI decrease, your BMI and also your blood pressure medications, it actually can show a very big impact on, very big decrease in blood pressure readings. Yeah, that's all. Any questions?
Thank you, guys. So if anyone have any questions, can you please raise your hand? Any questions? No? Okay. So I have some questions for you that I have prepared. So basically, in terms of the vegan population, they were less willing to take medications, or the blood pressure was indeed lower for those vegetarians. So was the vegan population less willing to take medications, or the blood pressure was indeed lower in the vegans?
Oh, actually in the study actually mentioned that the vegan population was less willing to take medications. There was like a statement in the discussion that they were not willing to take, but also it was also the factor of like their blood pressure was already indeed lower. So I think they didn't raise it, but I guess the reasoning would be that they really didn't see how the medications will actually help them over a long period of time.
And then what are the contrasting findings between the discussed study and the EPIC Oxford study regarding to the hypertension in vegans, especially considering the potential impact of calcium intake? So was the calcium intake beneficial of what they were taking, or?
This one I'm not too sure, but in regards to even at the end of the discussion, they were saying, sorry, let me just pull it up. Oh yes, they were saying overnight urinary, I'm not too sure about this, but because they only discuss about like potassium, but not really calcium at the end. But even with the potassium, they eliminated the data from this study, because of frequent use of diuretics, will distort results. So I'm not too sure about that. As like that statement was, the entire paragraph was like, there was no link to like really the study and also like the calcium and whatnot.
And then you were saying as well that the participants wouldn't have an era how they choose it. So what would you do different if you were able to do the study? How would you able to do the randomized study, or how would you do it?
So basically, because of the nature of this study, is like cohort design. Sorry, do you want like a population, or like do you just want a small group of people kind of thing?
It depends of how you wanted to run the study, of like if you're saying that it was a limitation of how they were run or how they will take the population, how would you do it to don't have any bias?
So basically, I will be using intent to treat method, which is basically RCT, randomized controlled trial. I would basically just take a small group of people and put them on the different, to let them try the diets for maybe a period of 6 months, because I don't think one of the main issues with RCT is that there's a lot of compliance issues in regards to long term. That's why most RCTs are not that long, and it's also very expensive. So I think a better method would be using intent to treat to cover up the bias, and also in that sense also you get to blind subjects and also the investigators to what diets they're doing and analyzing as well.
Thank you. Thank you, guys. Do you have any questions? I'll pass the microphone.
I was just curious to as what made you choose the PowerPoint theme?
Which one? Sorry. Hello. Sorry, which one? Which PowerPoint?
I was just curious as to how you came about choosing that PowerPoint theme.
Like the black and white?
Yeah. No, I was just joking though. I think it's a great theme. I'll probably pick a similar one for mine.
Thank you so much for your question. Anyone else? Yep.
Thanks, Nathaniel, for your presentation. Well done. I was interested in the food frequency tool used, so what the researchers used to measure dietary intake in this group. Was it specifically developed for a Taiwanese population, or could you tell us a bit more about the tool itself and how valid it was for use in this group?
For the food frequency questionnaire, sorry, let me just put it up. So, I would say they used it. It was a food frequency questionnaire, not specific to Taiwan, because on the references, it showed that the food frequency questionnaire template was actually taken from Adventist health studies, and also like basically more American version of this study. So I would say that the food frequency questionnaire, in regards to the general population, it's probably valid, but in terms of towards specifically Taiwan and Taiwanese diets, I would say it's no.
Yeah, okay, yeah. Because I wasn't sure if it was a valid tool or not. So do you see that being a problem then, that they've used a tool that's developed and validated for a US population and trying to measure diet in a Taiwanese population?
I would say yes, because the diets between a Western and Chinese diet will be more different in the terms of what they consume, and even things like, for example, like you don't really hear of like turkey being eaten in like a Chinese cuisine.
Yeah, I'm just looking at the list of foods in the FFT.
Yeah. So in that whole scheme of things, I would say that it's not really valid in terms of like, if you're talking about specifically to Taiwan, then no, it's not.
Yeah, I think I agree with you. And yeah, looking at the food list there's lots of things there that probably are not usually consumed in that population. So yeah, that's an important thing to look for, especially in observational studies like this. That the food frequency tools that have been developed have been validated for use in the population. I guess what do you have any comments on how this has perhaps impacted on how accurate the estimates of intake are and how they've classified the different people into this study? Are there potential errors there that have been introduced?
I would say because the definition also of, in terms of when describe their whole table of what is partial vegetarian, what is lacto-ovo vegetarian, and also purely vegan. I guess in terms of these terms, those are very definite terms, regardless of what nationality you come from. It's just mainly like lacto-ovo, you just have milk and eggs. So you have milk, eggs, and like your normal vegetarian diet. So in that aspect, I don't see how it would be. In terms of that general aspect, I don't see how it would affect the results from in this Taiwanese population study, because we're talking about just generalized vegetarian diets and their definitions, even when they stated in the study. Yeah.
Okay. And my other question was going to be, because did they only measure diet at one point in time?
They used, you can argue that for the health database, because it's also historic and over a long period of time. So some of them could have been staying in hospitals, some of them may not be staying in hospitals. So there's argument for the for any dietary recalls and whatnot from the hospital.
Yeah.
But this food frequency questionnaire is really just like a one-time
Yeah, so they
whole
measured
thing.
it once here. I guess, my question was going to be about what happens if people were following perhaps maybe were vegetarian earlier, like prior to the period of when diet was measured, or after they did the diet, the FFQ, they switched their dietary patterns. Was that accounted for at all, or did they, did they take into account?
It was not accounted for in this study, because there was no mention of those. The only thing remotely close to accountability is just missing data, and also, sorry. Yeah, they just said there's inevitably recall and reporting error, but they didn't really specify in terms of what you mentioned, in terms of compliancy, changing diets halfway, or being on a long-term vegetarian diet and just changing before FFQ. There's no detailed explanation for that.
Yeah. Okay. Yeah. Thanks for answering my questions.
I just wanted to add on that, but they also said in the article that they were in the limitations. It could be that the vegetarians, they can be diagnosed before then, saying that they have high blood pressure, and then they're starting to do the vegetarian diet. So because it was the past year, they didn't know what was. So they could say, yes, this is what I have eaten, but it's also bias of what they could say, or if they have been diagnosed before then.
I saw in the methodology that they were recording physical activity. I'm sorry if you already referred to this in your presentation and if I missed it. But did they ever discuss how the physical activity, how they related that to the outcomes at all?
Sorry, let me.
I mean, I could be wrong, but I swear when I was reading through the methodology, they.
All right. They just mentioned they didn't really put that in a long statement, but they just said the physical activity could not demonstrate significant effects on blood pressure in the study.
Oh, okay, cool.
Thank you. Any more questions? Anyone has something to say?
I just want to follow on what Casey said. I got a little bit lost. Did they do one food frequency questionnaire recalling the whole previous year? Because that seems like a really long time to recall. And what would the bias be for that? I didn't see them mention anything about it.
So basically from the food frequency questionnaire, they were recalling diets from long term, but there was a part in the article that showed that if you are on the vegetarian diet greater for more than 1 year, so in terms of that, other than that, I'm not too sure about the thing, about how many food frequency questionnaires were taken throughout, but in terms of this study, they were just mentioning that we did this thing once, so it was just one food frequency questionnaire. But in between, in terms of their normal hospital visits, and if they did a food frequency questionnaire or any dietary recalls, they didn't really state how many were done in that whole term. Yeah.
Yeah. Just to add to that point, food frequency questionnaires, I guess they're trying to capture usual intake. So especially with a lot of national health surveys like this or national nutrition surveys, the tools used usually are asking about intake over the past year. That's a typical time frame. What normally happens is that those tools get validated with a subsample of the participants usually completing 3-day weighed food records, and then they look at a comparison between that subset of people and how that performs against nutrient and food estimates from the food frequency questionnaire and make some comments on that. Because I guess, so that's what normally happens with food frequency questionnaires and the validation process.
Just to add as well, they also said that they miss a little bit of dairy products as well into the food frequency questionnaire. So that would be if they will do the research again, they would have put more dairy products to relate to those other vegetarians and as well the ones that they wouldn't have any other type of food. So pescatarians as well as the ones that will have eggs as well. So they would have put more dairy intake because the food frequency questionnaire didn't have as many products there, and then they will measure for the whole entire year. Any other questions, guys? Or Natalia? No? Thank you so much again.
Thanks very much, Nathaniel, for being first cab off the ranks today with your presentation, and thanks, great job to Karen fulfilling duties of our first chairperson. I think you did a very good job, so thank you. So I'll invite people down to just make sure I've recorded your attendance today. If anyone needs help troubleshooting Mahara and submitting that, then I'll camp down here and you can come and see me if you need some help. And honours students, stay tuned for more info via Alison. She'll be in touch via email, I'm sure. But other than that, thanks everyone for coming along. I've also made live now on the Flow site the Journal Club schedule for the rest of the year, so that's up until July. So you can see everyone's papers now. So I know as part of your Gantt charts, planning activity that you have planned sort of what sessions you are going to attend. So now you can actually go in and see which journal article you perhaps want to pick to summarise for your to meet your requirement for 6 articles. So I was really impressed, a really great range of articles that people have selected. Some, I'm really looking forward to hear you present on, so well done. A few people just by chance did pick exactly the same article, so I've notified you via Flow if you need to have another go at picking one. So I guess you can contact me if you need some help with that. Some other people, there was some people have oversubscribed to the Journal Club sessions in that we didn't have enough presenters to the number of chair people that wanted to chair that session. So if that applies to you, I've pushed you back into the big group, and you'll need to have another go at trying to find a date. So please have a go at doing that. But again, if you need some help from me, or it's not going to work with placements, or you've got some other circumstance, then get in touch with me, and we'll work something out. But any other questions? Thanks everyone for engaging today. You did a good job, lots of good questions. So if there's nothing else, I'll end it there. I have recorded the session today, and the next couple of weeks are recorded, because I think some people who aren't attending sort of until they present wanted to be able to access some examples of other people doing their presentation. So you can find that in the lecture recordings area as well if you want to refer back to these sessions. If anyone has some remote attendance requirements because you're going to be on placement at some stage, please contact me via email, because these sessions aren't set up on Teams, and they're not going to be, beyond the next few weeks, not going to be recorded. So I'll need to make a Teams classroom for anyone that needs to attend remotely. So please let me know if you have those dates in advance. Okay. All right, thanks everyone. Really nice to see you all in person again.